Director, you have something to say?
Yes.
Proceed.
Yeah, instances where things are pushed to you, you don't have control on how to process them. So it becomes a bit challenging. The best we could do was to go back to the vessel that carried the items, which we did, and they confirmed to us that they didn't, the 21 packages never landed.
Thank you. I think for the purposes of us to proceed, honorable members, I'd just like that we direct, and I want the clerk to note that we, on our deliberations on this matter, will need to refer to the document we were given by Ministry of Health yesterday, which is the letter of donation intent. And this was letter written to Ethiopian Public Health Institute from JACMA. And just for the purpose of clarification, it said in the, it's an appeal in order to improve people affected by COVID. And they have said, I just want to read the last bit. There is a value to come through Ethiopian Public Health Institute. These goods will be sent to Ethiopia Public Health Institute for prevention of and control of COVID. And then they go ahead to say the quality is as per indicated by the Ethiopian Public Health. That's the first one. I think Annex 1, I just want the Secretariat to note. Then there's an annex, there's also the letter, Federal Democratic Republic of Ethiopia, Ministry of Foreign Affairs. This is addressed to it's addressed to the Embassy of the Republic of Kenya in Addis Ababa. And then it has the honor to inform the letter that with further reference to the note verbal, the one that I've just read there, the second round of donations from Haiti Prime Minister Abiy Ahmed JACMA initiative to reverse COVID-19 pandemic from Africa is arriving in Addis Ababa soon. And then they go ahead and say in this regard, once again, as we appreciate the support, they say there will be donations, ventilation machines, medical disposal, and then they go ahead. And then say the Ministry of Foreign Affairs of the Federal Republic of Ethiopia avails itself in this opportunity to renew the Embassy of the Republic of Kenya the assurance of its highest consideration. Then from there, there is also an attachment. I just want for the Secretariat to note on what was to be given. There's a list. Detection kit, 96, there were 210, and the numbers. Lab tests, ventilators, infrared thermometers, 81. I think these are very important documents, civilian N95 mask, and the list goes on. And finally, there's also a document showing all African countries and how the distribution was done. And I can see Kenya there, so that then we can confirm the numbers. I can see the numbers were almost the same to all African countries. And then from Algeria all the way, there's a list which is important that Secretary, as you note, Annex number 3, so that we are able to follow as a committee when we sit, and then we'll be able to find out if there are any gaps. So, CS, do you have anything else to add or any concluding remarks?
Yes. Yes, Honorable Chair.
Chair, is it important to seek clarification on the document so that when you're responding? Madam Chair, I've just heard you saying Ethiopian Public Health Institute.
Yes.
And then we have got African Center for Disease Control. You know, here we have communication from the Ethiopian government. That is Ethiopian Public Health Institute to the government of Kenya, indicating the quantity, the number of items that are going to be supplied. Here, the government of Kenya is receiving items from Ethiopia, but African Center for Disease Control. So, is there confusion on these institutions? The government of Ethiopia and Center for Disease, which is under African Union. And as I know, African Union, Ethiopia has no control under African Union. So at what point did Ethiopia get involved on this issue of JACMA? That is a clarification that I will want to seek. And to the director, one of the reasons JACMA decided to send items to Ethiopia was quote in quote that there was some corruption, that it will get lost in African countries, including Kenya. But today you are here telling us that the JACMA donations got lost in Ethiopia. So is it now confirmed that there is corruption also in Ethiopia, where the African items got lost from JACMA? And JACMA needs to be advised that there in the future, if you have to send any donation to Africa, send it to the respective countries, not Ethiopia. Thank you.
Yeah. Chair, please, I have something to say.
Captain, I'll just give you 30 seconds because
Yes,
time
I'll-
is not on our side. We have people waiting, and we
Sawa.
also will be sitting here. We don't want again to finish like yesterday, very late.
Sawa.
Yeah.
Chair, hapa nimeona kuna hatari kubwa. Ni lazima hii wizara ituambie kama hakuna sheria tutunge sheria. Manake vile mnasema 22 21 imepotea. Je, kama ndege ilianguka, huo mzigo wote ungekuwa umeenda hivyo? Je, kama mnapeleka na meli mzigo wa pesa nyingi ukiwa umepotea, so inamaanisha hamuna njia za kufuatilizia. So mimi nasema hii mambo ya insurance ni muhimu. Kama itabidi sheria hakuna, tutunge sheria, mzigo wote wa serikali unaokuja huo umewekwa insurance. Manake ni hatari, itakuwa pengine pesa bilioni nyingi na tuambiwe meli imezama. Kisha itakuwa imeenda hivyo hivyo. Tutakuwa hatuna njia za kuclaim. Hii kama alikuwa mmeweka insurance, I'm sure kuna muna hiyo sheria ya kuweka insurance. Tatukwaje mzigo tu mtume hivi bila insurance? Tafadhali nataka kujua kama hakuna sheria hiyo, basi sisi tutunge sheria, manake ni hatari. Inaweza wekwa bilioni kadhaa kwenye meli, kisha meli izame, pengine hata meli imezama na hakuna hizo bilioni hapo ndani. Kisha tutaenda vipi?
Sawa, tosha. Ya tosha sasa. CS, let me allow you to do your conclusion.
Yes.
We need to conclude this matter.
Yes, Madam Chair. I know we've been discussing this for a long time. Madam Chair, my Ministry of Transport, Infrastructure, Housing, Urban Development and Public Works, had only one role in this matter: to clear the goods that arrived at Jomo Kenyatta International Airport. And we were involved merely because administratively the ministry was in charge of the agency, the government agency that is responsible for clearing goods, namely the government clearing agent. That was administratively under the Ministry of Transport at the time. And I was going to make one request, that all this is really a matter for the Ministry of Health in conjunction with the Ministry of Foreign Affairs to clarify all the issues about this donation in response to some of the questions that have been raised here by members. And I wish to make a request that in the light of the changes that have recently taken place, where even the government clearing agent has been moved from the Ministry of Transport to the National Treasury, really as a ministry, as the Ministry of Transport, we have no standing in these matters anymore, and I wish to request that we be allowed to deal with the mandate placed in our hands apart from this particular one. And therefore, I wish to request that this matter is pursued with the Ministry of Health and the Ministry of Foreign Affairs to be able to provide answers for the various questions which have been raised by members here. Thank you.
Thank you very much, CS and PS and your team. You may take leave now. We will follow this matter. Asanteni sana. I would request the Sergeant at Arms to allow the second group to come in, the group from KEMSA and also the suspended officials, and also for sanitizing the areas where those people are seated. Sergeant at Arms, please be fast. Yodi, why is Muridi? Let's have order. Honorable members, I want to call the meeting to order. And since we had prayed, we will go straight to introduction. I'm very sure we have the team from KEMSA. I can see the chair. And I just want to confirm that we have Dr. Manjari. Where's Mr. Eliud Mureithi? And Charles Juma? Okay, and we are ready to proceed. Honorable members, I would like we start with the introduction. We'll start from my right, Honorable Joyce Emaniko.
Joyce Emaniko, MP for Turkana County and a member of this committee. Thank you.
James Nikal, Member of Parliament for Seme Constituency in Kisumu County and a member of this committee.
Honorable Sally, your microphone. Maybe you can move. There's one behind you. Professor?
Professor Mahmoud Sheikh, Member of Parliament for Wajir South and a member of the Health Committee. Thank you.
Captain Roida Mohammed, County Women MP, Lamu, member of this committee.
David Eseli Simiyu, member for Tongaren.
I'd advise maybe you sit there or they fix your microphone, Dr. Eseli. Yeah.
Gabriel Tongoyo, MP for Narok West and a member of Health Committee. Thank you.
Sangaret Koros, Member of Parliament, Sigawet Soin, and Member of Health Committee.
Good morning. Adagala Beatrice, Woman MP, Vihiga County, and a member of this committee.
Honorable Joshua Kutunyi, MP Cherangany, Vice Chair, Health Committee.
And I'm Sabina Chege, member for Muranga, and I chair the Health Committee at the National Assembly. I request the chair to introduce yourself and your team.
Kembi Getura, Chairman KEMSA.
Edward Njoroge, Acting CEO, KEMSA.
Josephat Mbuva, alternate for the PS Minister of Health in the KEMSA Board.
Eliud Mureithi, Director Commercial Services, KEMSA.
Charles Juma, Director Procurement.
Dr. Jonah Manjari, CEO, KEMSA, suspended.
Oiganjo Karanja, Director Finance Strategy, KEMSA.
Joy Rigesuka, Member of the Board.
Dr. George Walukana, Acting Director Commercial Services, KEMSA.
Edward Biluma, Acting Director Procurement.
Do we have anybody else who have not introduced themselves? Did you do your introduction? Okay. I'd like, as we proceed, if there's any documents to be tabled before the committee, you can approach Mr. Muyodi, who is in charge of our secretariat, and give us the documentation. I would like we start with the suspended officials before we come to the submission by the board, because there are some issues that might be arise and the board would also need to address. And we have Dr. John Manjari as a person who was a CEO. We have Mr. Eliud Mureithi and Charles Juma. I would want to start with Dr. Manjari. I just want, from the letter we give to this committee, you clearly tell this committee the role you played in procurement of COVID-19 related items and the role you played in the processing of all COVID-19 supplies, donations. And at the same time, would be interested to know the expenditure by the time you're being suspended, and who approved for that expenditure. I would also want to know whether you did any survey to advise you on the expenditure taken on behalf of KEMSA. And you'll also tell us the turnover in the last 4 years, if you have, what was the value of reserves as per 30th June 2019. I'll start with Dr. Manjari.
So, thank you, Chair. I would wish to state that during the COVID period, we did various procurements for the supplies that were needed during that period, the pandemic. And I play the role as a CEO where I do the day-to-day running of the authority. And we work as a team where, when we did get the advisory that we need to be prepared for the COVID pandemic, we did have several meetings as management, and we came up with the specifications for the items that were needed at that time. We did reverse procurement as provided for under Section 69 of Public Procurement and Disposal Act 2015, 2, where it is provided for reverse procurement or retrospective procurement, and also as guided by Section 103 of the Procurement Act. We will give more elaboration on those two provisions of the Act. At the time of the declaration of the pandemic, as you are aware, KEMSA had already passed its budget for 2019-2020, and by March 2020, when the pandemic was declared, there wasn't per se a budget in KEMSA for the procurement of the COVID items, as it was towards the third quarter, the end of the third quarter of the financial year. So we relied on the assumption that, it being a pandemic, we'll be able to access funds from the emergency funds that are provided for by the government, and from the donors that were declared interest that they'll be providing us with budgets, from the MOH, or Minister of Health, and subsequently from the reserves that we have in KEMSA. We did indeed do a market survey, as for all the procurements that we do under direct procurements, all open procurements. In March and April, there was lockdown in China and India, where most of these products come from, and also the US government indeed did what we call barring or banning any exportation of ventilators and 3M products like N95. So the demand was very high and the supplies were very limited, and we did have supplies prices that were quite high at that time. Will be through the office of the acting CEO. I couldn't get access to some of the documents, but he has a price list of how those products were costing at that time. The turnover for the last 4 years, the director finance and strategy has that table of the turnover for the last 4 years. But I would wish to say, for the KEMSA capital, we have grown from 2 billion to 4.2 billion or thereabout during my tenure, showing an upward increase of the revenue at KEMSA or the reserves as KEMSA. The finance director will give the details of that. It is my submission that we did this procurement during very hard times, and we are reminded that as we do this, there was a panic in the country and hard decisions had to be made. And it is in view that as we make small decisions in life, we are expected to use our heads. But as we make very hard and big decisions, we use our hearts. It is for the passion I have for this industry and for the healthcare workers, the frontline healthcare workers. I'm one of them. I'm a medical doctor who has served for more than 23 years. And I really needed to protect them and make sure that they did not have any infections that we had seen happening in other countries. And the modeling that had been done at that time, we had been shown that there would be around 10,000 COVID cases by end of April. It didn't happen, but as you know, as of now, we have over 34,000 cases and more than 19,000 active cases, meaning we need to continue giving more support to the healthcare workers. Finally, Madam Chair, I would wish to refer to the KEMSA Act, where the budget, we are told, or the utilization of the KEMSA funds in section 14(3), unless Treasury otherwise directs, the balance of the funds of the authority at the end of the financial year shall be retained for the purpose of which the authority is established. KEMSA mandate is given in the Act and is to procure, warehouse, and distribute health products and technologies to all public health facilities. And finally, Madam Chair, in the same Act, if you may allow me to read, the manner of the discharge of KEMSA functions, we are reminded that we need to have products that are of high efficacy, safety, quality, and affordability of the health products and technologies. And I wish to thank the Department of Quality Assurance for making sure that Kenya and indeed KEMSA did not have any substandard health products and technologies, including the PPEs. And we did reject quite a number of products that came our way. We are also reminded that we have to observe a steady supply of drugs and medical supplies to the public health facilities in this country. Madam Chair, the final function in a manner that we are supposed to discharge our functions, we have been told to maintain and sustain strategic reserve of essential medicines and medical commodities. It is to the assurance of this committee that we need to assure that Kenya, and indeed KEMSA, is ready with health products and technologies. For the first time, we are to meet our clarion call or having 100% order fill rate for PPEs. At this time, we have products and technologies that can last this country for a period of more than 6 months. It is my humble submission that all these procurements we did with our eyes open, with a passion in our hearts for the safety of the healthcare workers as they did their duty. Madam Chair, the hedgehog concept tells us that you need to have passion. You need to look at what is there to be referred to, and at this time, maintain very good resources. And we have maintained our culture at KEMSA of procuring what is required. Madam Chair, I submit, and I'm ready and available to answer any question that the members may wish to get clarification from myself. Thank you.
Thank you. Since you've used some term reverse procurement, I would want to give the opportunity to Juma to just explain to this committee the kind of procurement. There have been several issues that the CEO has said. It was emergency. You referred to the act, all those things. Could you just take through this committee, what is that reverse procurement that you did? And maybe as a procurement officer, the CEO has said you had several meetings. So did that meeting include the board to make the decision on what was to be procured? And I've also seen we have the representative of the PS. So was a representative of the PS in the board also part of the team that was making decisions on procurement?
Thank you, Madam Chair. And the members, I'll be able to take the members through the requirements of the Public Procurement and Asset Disposal Act. My role in this procurement of COVID items is that to ensure that we comply to the requirements of the law. And when COVID came on board, we noted that this was a procurement which came at a time when we could not be able to do the ordinary procurement, which is do advertise, wait for the bids to be submitted within a specific timeline, and carry out the evaluation, and notify, and wait for 14 days, and then sign the contract within 21 days. And therefore, the procurement of COVID items was undertaken on an emergency basis by way of direct procurement, in line with the Public Procurement and Asset Disposal Act 2015, Section 103, 2, B and C, and Section 69.
Audio and ICT, could you kindly just fix whatever is making that noise? We need to clarity when the presentations are being done. If the IT person can hear me, you need to fix that microphone. Otherwise, we will see like there is sabotage in this presentation. You can proceed.
Thank you, Madam Chair. First one to Section 103(1) of the Public Procurement and Asset Disposal Act. A procuring entity may use direct procurement as allowed under subsection 2, as long as the purpose is not to avoid competition. And Section 2 says, a procuring entity may use direct procurement if the following are satisfied. And Section B says, due to war, invasion, disorder, natural disaster, or there is an urgent need for the goods, works, or services, and engaging in tendering proceedings or any other method of procurement would therefore be impractical, provided that the circumstances giving rise to the urgency were neither foreseeable by the procuring entity nor the result of dilatory conduct on its part. Section C says, owing to a catastrophic event, there is an urgent need for the goods, works, or services, making it impracticable to use other methods of procurement because of the time involved in using those methods. And I just explained earlier that the normal method of procurement, the default method of procurement, is open tendering. And in this case, if you would have would have gone the way of open tendering, and then we will not be able to obtain the commodities which were required urgently to manage the COVID-19. And when you go to the definition of urgent need, as indicated in this section B and C, the definition of urgent need, as per the Act, it says, the need for goods, works, or services in circumstances where there is an imminent or actual threat to public health, welfare, safety, or of damage to property, such that engaging in tendering proceedings or other procurement method will not be practicable. And therefore, Madam Chair, we noted as KEMSA that at this particular moment, because of COVID-19, there was a threat to public health. And the only way to safeguard the safety of the Kenyans was to ensure that we obtain the commodity which will be required in the shortest time possible. Section 69, which the CEO had just indicated, on how we used what we call it retrospective procurement. It says, Section 69, pursuant to Section 69, 1 and 2 of the Public Procurement and Asset Disposal Act 2015, 1 says, all approvals relating to any procedures in procurement shall be in writing and properly dated, documented, and filed. Section 2, which talks of retrospective now, it says, no procurement approval shall be made to operate retrospectively to any date earlier than the date on which it is made, except on procurements in response to an urgent need. So only procurements on urgent need can you be able to do what we call it reverse procurement. And this case, for the purpose of procurement of COVID items, we did what we call it reverse procurement, formalization. Reach out to suppliers who have the commodities in the market and ensure that we get the commodities in the fastest available time, and then formalize the procurement process. And therefore, the process which followed later was in line with the procurement law. The procurement of COVID items was carried out as follows. The prospective suppliers wishing to supply the various items under COVID submitted letters of intent indicating that they wish to supply KEMSA with health products and technologies indicating expected delivery dates. The intent letters indicated the time, the item description, quantities, expected delivery date, and price. The suppliers were required to submit samples that were evaluated by the technical personnel, that's the quality assurance, to ascertain conformity to the technical specification. Once samples were found responsive, the suppliers were issued with commitment letters indicating item description, quantities, and delivery timeline. In the commitment letter, it did not indicate the price because the price had not been negotiated, but we looked at the prices the suppliers had offered the commitment letters and noted that they will be within the market prices, which will be negotiated. And the second step was after the suppliers delivered the goods, a request from the Commercial Directorate approved by the Chief Executive Officer was forwarded to the Procurement Department for processing. The Procurement Department prepared and issued a tender document to the supplier with the submission date and time. The Chief Executive Officer appointed an ad hoc evaluation or negotiating committee pursuant to Section 46 of the Act to undertake evaluation and negotiate with the supplier. The evaluation committee prepared minutes of the negotiations, and an evaluation report was with the recommendation which were duly signed by all the committee members. After this one, the evaluation report and the minutes were forwarded to the Director of Procurement, who prepared professional opinion to the Chief Executive Officer for the award of the tender. Upon approval of the award recommendation, a procurement sent notification letters to the suppliers. Subsequently, the suppliers submitted acceptance letters. The Procurement Department prepared contracts which were forwarded to the Legal Department for verification and formalization. After signing of the contracts and upon receipt of the necessary delivery documents, the finance department will be able to process the payments. And that's the process which we undertook, which we followed during the procurement of COVID procurements.
Is that all you have to submit? Did you have any other submission? Put on your microphone, please.
The other submission I'll be able to make is that on the budget, I'll just concur with the CEO's remarks and go with it that during this period, because COVID-19 was an emergency procurement, there was no allocated budget. The budget which was used was the budget which had been approved earlier, the budget for procurement of health products and technologies, which was an approval of 4.6 billion. And on the question which was asked whether I had any role to play on supplies of donations, the delivery of all donations are received in the KEMSA warehouse, in which the procurement has no role to play because there is a directorate in charge of the warehouse and the distribution. So I did not play any role on the supplies of donations. On the question which was indicating did the KEMSA board approve the procurement of COVID supplies worth 7.1 billion, I can be able to bring to the attention of this committee that on 19th of March, there was a board meeting with the senior KEMSA management in which the board directed the senior management team to ensure that the commodities which will be required to manage COVID-19 should be available and used. And I remember the chairman making the remarks and saying, the director of procurement, I hope this time your rules will not be able to impede this procurement. And I responded, I said, it is not my rules, it is the laws which were passed by Parliament. And I think he thought maybe I was too detailed to the procurement law. And that was my response by then. And when we left, we were given assurance that we need to prepare and ensure that we obtain these commodities from wherever it is, so that we don't go the way the Italy and the other countries has gone where the basic items had missed. And the other question was, did KEMSA undertake price survey before undertaking procurement? I can be able to say that, yes, KEMSA did undertake price survey, although this price survey was difficult because a number of these COVID items are not what we call it stock items, and there were few suppliers who could be able to get this item. And in other instances, there were even no suppliers completely. And therefore, the price in the market was distorted. And the suppliers, because they noted that the demand was too high, there was a lot of hoarding for these supplies, and the prices obtained were quite high. I remember that particular moment, the price of the masks which I'm wearing was going between 5,000 and 7,000. We agreed as KEMSA management that since we are buying in bulk, we can only be able to buy at a maximum price of 4,500. And that's the price we obtained the face mask. The price of personal protective equipment in the market was between 12,000 and 16,000. And therefore, we noted that for our procurement, which we do in bulk, when we did all the market survey, we agreed as senior management that our price will not exceed 9,000. That's what the best price we will be able to grant anybody who will wish to supply KEMSA. The sanitizers, if you look at that particular moment, the sanitizers 500 milliliters or 500 ml. By then, the price of the sanitizer was 685 to 700. We agreed that we will not be able to buy the sanitizer at a price not exceeding 500. So the prices, therefore, which we obtained, the COVID items, were prices by then in the month of March, April, and May. Those was the best price we could be able to obtain. And for the members, therefore, is that if you look at other entities which did similar procurement, we also did a market survey with MEDS and other entities which were procuring similar items, Nairobi Hospital, Aga Khan, and even UN. UN was buying the PPE, personal protective equipment, at 12,000, compared to our price, which was 9,000. And therefore, we could be able to confirm that we did carry a market survey, although the market prices of the items was distorted because it was an abnormal situation at that particular moment. And therefore, I submit, Madam.
Thank you. I want now to go to, is it Elliot Muredi?
Uh,
Well, as you do your submission, we have received documents earlier to see you are on constant communication with the PS. So as you do your submission, this committee will be interested to know your role at KEMSA, and especially at this time of COVID, what was your role? You've also been mentioned that you are giving advice, before the procurement was done. So let it come out clearly what your role was.
Madam Chair, maybe just to intervene.
Yes.
I want just to bring one comment which I just forgotten.
Okay.
During that time of the procurement, the Public Procurement Regulatory Authority gave out what we call it an advisory on how to carry preventive measures for handling of procurement activities for procuring entities due to the coronavirus. It was a detailed advisory which was given by the regulatory authority, how to handle procurement during that time. We also have an advisory which was given by advisory to MDS on procurement procedures applicable to urgent purchase to deal with COVID by the Solicitor General. So this document also guided us on how to carry procurement.
Would you be able to table those documents?
Yes, I can be able to table this document.
You can just approach the chair and just table the documents. And any other document that you'd feel would help this committee in its investigation. Elliot Moredi.
Okay, thank you, Madam Chair. So I will go straight away to the questions posed before me, the role I played in the procurement of COVID-19 products. And for proper context, Madam Chair, I would want to clarify 3 levels of involvement. And the first level of involvement is the extent of the mandate and role of KEMSA at institutional level. That was very well explained by the CEO, so I won't belabor on that. And then the role of the Director of Commercial Services under normal circumstances, and the unique situation during COVID-19, and the role of the Director of Commercial Services within superseding unprecedented circumstances posed by COVID. So the main purpose of the position of the Director of Commercial Services at KEMSA is to oversee sales and marketing and development of marketing opportunities, and then overseeing establishment and growth of strategic partnerships with different stakeholders. And then my other role is to oversee meeting the needs of KEMSA customers. So the role includes both identifying revenue-generating opportunities for KEMSA, as well as managing key client relationship in line with KEMSA's overarching mandate. And possibly this is why I was in constant communication with the PS, and not just the PS, I was in constant communication with different stakeholders within the public health sphere, including the counties. And I would want to say that in all this communication that I was with the PS, I did put my chairman in copy and also my CEO in copy. And Madam Chair, I also want to state that on the 10th of April, I did write an email to the heads of departments, different heads of department I was working with from the ministry, and I stated that all official communications and instructions should be channeled through the CEO's office. But nonetheless, I am not complaining that the PS did communicate with me. Reason being, the CEO had mandated me to be interacting with the ministry on different fronts, like we were participating in a committee called Resource Mobilization Committee, where I would meet as different stakeholders within the health sector to review COVID situation and map out strategies on how to mitigate the spread of COVID. So in that regard, Madam Chair, I am sure the CEO is not complaining. I'm not complaining that the PS did communicate with myself. And again, being the accounting and authorized officer in the Ministry of Health, the PS indeed is free to get in touch with anybody within the ministry. Then, Madam Chair, exit the norm and enter COVID-19. I would want to say that with the unprecedented situation, KEMSA found itself in a unique mandate occasioned by the crisis on availability of COVID-19 related products, and especially so because of the supply chain disruptions. And my colleagues did allude to the different circumstances we were in, where we even had reverse export of COVID products out of the country to even China, Madam Chair, that entailed that we had inadequacy of COVID-related products. And that's why our colleague in procurement advised that we are allowed by the law to go for retrospective procurement. I am not an expert in matters procurement.
Point of order, Madam Chair.
What is out of order?
I've heard the director, I think, is it commercial?
Commercial, yes.
That they were advised by their colleague. Maybe through the chair, he could let us know whether that was in writing or verbal, because that is where there's the crux of the matter. So if the advice was in writing, let him table it, then questions will follow thereafter.
Okay.
So thank you, Madam Chair. Indeed, we did have meetings, and the procurement director did clarify, even before the board, that retrospective procurement is allowed in law, and he also did a written advisory on the same. And I think he has alluded to that fact, and he said he'll be tabling those documents, Madam Chair. So, Madam Chair, I would also want to mention that COVID-19 HPTs were not the traditional health products and technologies that are stocked by KEMSA, apart from a few, like sanitizer and surgical masks. So we had framework contracts for those ones. So we continue making what is called call-off, where you just ask the supplier to deliver based on demand, since you have a framework contract of 2 years. But nonetheless, I think there were competing requests from the private sector, government agencies, and one of the suppliers I would mention is Cambry. So Cambry found itself not able to meet demand, the forces of supply and demand. So that's why my colleague in procurement and the CEO said we had to reach out to other people. So I would also want to submit that the period between April and March, April, and May, saw a period full of panic and desperation from KEMSA customers under these very unfamiliar circumstances. So being the commercial director, I got a lot of requisitions, requests, even from this house. Parliament also requested us to supply things like sanitizer, face masks, and all that. So basically, all entities in government were requesting for the supplies. We didn't have supplies that particular time because the deliveries were slowly coming. So we would rationalize, Madam Chair, and we were under a lot of focus and scrutiny, and of course, a lot of criticism for not meeting the demands of the market. I would also state that, Madam Chair, the overall expectation both within the country and internationally was for institutions to take extraordinary measures and make concerted efforts, with the priority being preservation of lives, as explained by my colleagues. And I also would want to submit that any responsible government and government agents of state, or other agents of state, had the single priority of ensuring once more lives are preserved. And again, I also want to submit that it would have been very utterly irresponsible of ourselves or any other government officer not to take appropriate measures to mitigate the effects of COVID-19. And Madam Chair, I want to state that at some particular time, we had to also airlift products to places like Mandera, when cases were announced in Mandera, Mombasa, and other places to ensure that lives are saved, including Kwale, when the first case was mentioned therein. So my involvement in the procurement process, I would state that I had no active involvement in the procurement process. And I would also want to point out, not just myself, the commercial directorate was not involved in the identification of suppliers, no visibility or role in relation to letters of intent. And of course, I mean, the commercial director was not issuing commitment letters. Of course, the commercial director was not involved in price negotiations. And then, of course, no role in the formalities of receiving deliveries, cross-checking quantities, quality, and the developing of the schedules. And in actual fact, Madam Chair, the commercial director would only get involved at the tail end, after the deliveries have been done and the quality verification done, and the procurement director has consolidated the people who have delivered the products, then I would be asked to do a requisition to formalize the procurement process as explained by the procurement director. Okay. And I would also mention that in some occasions, requisition would be done in line with specific requests from the market, including county governments, DOD, the National Assembly, tertiary referral hospitals, including Kenyatta, Mathari, Kenyatta University, among others. Then, Madam Chair, I would also want to state that in regard to the role I played in terms of COVID-19 supplies donations, is that this particular role rests, of course, under the purview of warehousing and distribution, because they are the ones who are receiving these particular products, Madam Chair. So I definitely would also want to confirm that having in mind that I was interfacing with the ministry quite a bit, I would get requests from the ministry, of course, through the CEO's office. The CEO would mark it to myself and the operations director. And I created an email, a group email, for all relevant KEMSA staff who are involved in processing these particular orders so that they are copied. So all those communications were going through to a group email. But the director of operations would be best suited to explain this further. Okay. The other question was in relation to whether the board approved the budget. The CEO has responded to that. And the other one was, did KEMSA undertake price survey? My colleague, procurement director, has explained that as well. And the other question is, what is the KEMSA turnover? Madam Chair, just to avoid any situation of indubitable figures, I would request that that is responded to by the Director of Finance and Strategy, but the CEO has tried to explain that as well. In summary, Madam Chair, I would want to state that it is necessary to appreciate the unique circumstances occasioned by the unprecedented COVID-19 and the need for prompt measures to address the situation which was rapidly unfolding, and not just in Kenya, but globally. And then the design of the process was such that, unlike normal circumstances, the involvement of the Director of Commercial Services was peripheral and only in relation to steps towards the tail end of the process. And then I would also want to state that amidst the unprecedented situation and the momentous challenges, I consider the situation to be ons that required us to act promptly for public good and in good faith. In all this, I was performing official duties and acted within the law, Madam Chair. I rest my case. I am ready for any questions, Madam Chair. Thank you.
You have the document to submit to the committee?
If you give me time, Madam Chair, I would then go and work out a document that I can submit.
And that same case with the CEO? Thank you. I want to open it to the members before we go to the board. And one of the issues that has come up from the previous presentations is that, CEO, you were given a capping by the ministry on what to spend. From the documents that we have received so far, you went over your budget as KEMSA and procured goods worth around 7 billion. Whereas the letters we got from the ministry, there was a previous letter that you had actually asked to spend 1.5 billion, and you advised only to spend the 700 million, around that figure. So who authorized you to incur expenditure above what was supposed to be part of your budget? And I'm very sure that budget was not only for COVID, it was for other operations within KEMSA. And how are you planning to recover the money that was spent? Where did you get the rest of the money to spend?
Madam Chair and committee members, as I had said during my submission, indeed, KEMSA was found itself in a very unique situation where we had an allocation of 4.6 billion to spend on HPTs, that is health products and technology. under this circumstance, we never anticipated that we will be using this money for the COVID-related expenditure. And the assumption, as I said in my submission, was that we'll be getting budgets from Treasury, MOH, and from the donors. Come the time when we did consolidate and we sent our budget support request to the ministry, we participated in very many meetings, what we used to call resource mobilization meetings. At that time, we did have a budget that had been given to us of around 1.1 billion, and from World Bank. And this was merged together with the KEMRI budget to include PPEs and reagents. So the budget that we were later provided for was 758 million, and the documents, I believe, had been submitted to this House. And as management, and considering that on March 19th, we had been told to procure adequate supplies to meet and observe our mandate in the mitigation and the fight against COVID, we did now make a decision as management to do utilization of the 4.6 billion. And as I had explained in my letter, our provisions for payments of our suppliers fall between 30 to 90 days, depending on the category of the suppliers. So we did know that this will be overlapping to the next financial year, which is now current 2020-2021. And we are hoping that the suppliers that had not been paid, as it has been practiced in KEMSA, where suppliers do supply within the month of May and June, and their payments fall in the previous or the subsequent year, in the subsequent year, we knew that the balance of what we had not paid, amounting to close to 2.9 billion, will be paid using the approved budget of this current financial year. As you are aware, Madam Chair, KEMSA do operate a revolving fund, and that is what we were hoping to utilize. We are also owed several monies by counties, the Ministry of Health, our strategic partners, and from other sales that we make to the referral hospitals and other faith-based organizations. So KEMSA had enough funds that would have been taken for request for approval to the board in this financial year. And we also continued to seek for support from the Minister of Health in letters that we had written to the PS. So, Madam Chair, it is true the approved budget was 4.6. The expenditure was around 7.7 billion, and we were hoping that the overrun of the budget will be funded during this financial year, Madam Chair.
Thank you very much. I want to open this to the members, but before then, we have the chair so that we can open plenary and engage the whole team, because there's a lot of overlapping of roles here. So, Chair KEMSA, you appeared before us last week, and we also mentioned that we might need you and your team back again here. One of the documents that was tabled last week was a document that you presented, that the PS had given the directions on what to be procured. And the PS has come and given a different submission on how that document was arrived at. So as you do your presentation, we'd like also you clarify to this committee whether you misled the committee or you didn't have the information, or you still maintain your submission earlier about that letter that was addressed to the CEO KEMSA by PS Mochache. And that's why we asked one question, the role of PS and CS in procurement process of in the 738 million. and also the role of the board in procurement process. There have been several meetings, and I think in the submission I've had a meeting that was held in March, and you are quoted asking the procurement person to be a bit flexible so that the country doesn't experience shortage of the required PPEs and other commodities. You can also do the same. And then we asked on the status report on the UET utilization so far by KEMSA. And our concern, for clarity, we just want to know whether the UET money that was given to KEMSA went to UET or some of these funds were used to procure the COVID items. So, Chair, I want to give you a chance to do your submission.
Thank you very much, Madam Chair. Madam Chair, I was before you last week, and I did make lengthy submissions on the issues that you addressed with me. Now, on the issue of the 758 million shillings and the letter from the from the Principal Secretary, Ministry of Health, I think it was April of this year. My answer to that question, if I remember correctly, and I'm sure the answer will bear me out, I said the letter speaks for itself. And I know that it has been discussed subsequently. And I've been on record as saying, Madam Chair, and I said this at the Senate, that subsequently it has become clear that that letter, the list that is attached to that letter of the several commodities that were to be procured, that list had actually emanated from KEMSA, then gone as a document to the PS Ministry of Health, and that is how it came to be attached with the companies to procure from and the prices. I'm sure that Dr. Manjari will be able to explain that much better than I could, but the position is that, as I understand it, the figures, the annexure to that letter of 758 million shillings had actually emanated from KEMSA in the first instance. So that's an issue, Madam Chair, with your permission, that I would ask Dr. Manjari to explain in due time in answer to the questions. You have referred to a document, Madam Chair, dated March, in which you said, I said something to the procurement department. I didn't understand that. Maybe if you could repeat that, please.
Not a document. When the officers were answering the question whether they consulted on expenditure, they mentioned that there was a board meeting on, was it 13th March? It was 19th March, that the board advised them to go ahead to procure and to save this country. I just wanted, 19th March, there was a board meeting, and you gave them a go-ahead to procure.
Madam Chairman, I've seen the draft minutes of that meeting. I cannot confirm or deny them because we had a meeting on that day. These minutes have not been signed because we have not had a subsequent full board meeting. But that be as it may, what I can confirm to this committee, Madam Chair, is that yes, the board did tell the management that in light of the COVID-19, because COVID-19 was declared a pandemic on, I think, on 13th or 15th of March. This meeting is on 19th of March, so we must have called an urgent meeting to deal with issues to do with COVID-19 and the kind of preparedness that we are supposed to be in. And what we did as a board was to ask management to ensure that they were prepared under the mandate of the KEMSA Act with the emerging issues to do with COVID-19. That would be correct. Whether or not the minutes that have been submitted to you are correct, Madam Chair, if they have been, just to note that these are not confirmed minutes and these are not signed minutes, Madam Chair, so that my comment on these minutes is only what I've said, that yes, we asked the management to ensure that they were prepared to do the COVID-19 issues under the mandate of KEMSA under the Act. Now, and I hope that answers the two questions. You've raised, the issue was raised of the role of the board in the procurement process and financial management at KEMSA. This question was canvassed again at great length the last time I appeared before you, and it will be found in the Hansard. But just to reiterate that the role of the board in the procurement on these issues was as per the board mandate, that is, to give direction on how the management does and conducts itself, Madam Chair, in these circumstances. But having said that, and as has been confirmed by both the CEO, Dr. Jonah Manjari, and also by Mr. Juma, Charles Juma, Madam Chair, there was a budget which was 4.6 billion shillings. The budget was for the period ending 30th of June 2020, but that COVID came in or about March of 2020, with only 3 months to go to the end of the financial year, and that therefore there was obviously no specific budget for COVID-19. The board approved a procurement plan at the beginning of the year, of the financial year, that is July 2019, ending June 2020. We approved a procurement plan and we approved a budget. Then obviously we left the management to deal with those issues. But in fairness to the management, Madam Chair, the procurement plan, of course, had nothing to do with COVID because COVID was not contemplated. It came towards the end of the financial year, precisely in the last 3 months of the financial year. The KEMSA, under its mandate, was expected to be prepared to deal with these issues, and the Cabinet Secretary, Ministry of Health, did come up also with these issues yesterday, and he said what he said. And all we can say, Madam Chair, is that we as a board acted within our mandate, A, to approve a procurement plan under the budget, and B, to ensure that the management was fully prepared as it is required to be in terms of dealing with emerging issues, in this case, the COVID-19 issues, Madam Chair. The only other issue now is to deal with the status report on the utilization of UHC funds transferred to KEMSA. Again, since Dr. Manjari is here, I'm sure he'll be he's quite well versed to deal with this. But the figures I have is that we received a total sum of 12.5 billion shillings. I can break it down if you wish. 12,506,762,961.90 to deal with COVID, to deal with UHC matters, Madam Chair. That we have so far utilized 5,394,646,656, leaving a balance of 7,112,117,305.90. And we have attached the necessary documents to show how those figures have been arrived at. I'll be asking, with your permission, Madam Chair, that either Dr. Manjari or Mr. Edward Njoroge, the acting CEO, gives you a breakdown of those figures should you so require. Then you have the last question you asked of the board was a status of the delivery and receipt of the procured COVID-19 related items, and we have attached a document to set out those the record clear on the request from you and your committee, Madam Chair. I don't believe there's anything else that I need to deal with at the moment, but of course I'm open to any questions. But the three directors, the CEO, Mr. Juma and Mr. Mureithi, have answered the questions that were put on them. And like they have said, Madam Chair, they are willing and they are ready also to answer questions, so I shall leave it to your discretion for now. That's all I can state.
Thank you, Chair. Last time we appeared before this committee, we had also requested that we get proper financial status of KEMSA. I don't know whether that document was given to our secretariat. And number two, we had also asked for a matrix of now the list of who has been paid, the ones who have not been paid, including the ones who have not been paid and they have not negotiated. We had also asked for that list. so that we know the ones who have delivered and negotiated, and the ones who have delivered and not even negotiated with KEMSA, so that we have the three metrics, a proper indication, and we can be able to know what kind of figures we are talking about. Having said that, I think the acting CEO, do you have any documentation? Or you can send for them to come?
Madam Chair, yes, we'll send for them to come on the financials. For the metrics, we did send a soft copy to your office, but we'll also make arrangements for that to be sent in hard copies.
Which office? The Secretariat?
Magut.
Okay. If you are able to get somebody to print for you, we'll be interested to have that matrix.
All right, and there's a hard copy that is in the file that has just been presented to you, although it's a bit.
Yeah, this is not clear. You see what we want, we just, the list of how much has been paid. The total amount of the expenditure that KEMSA did without the expenditure from ministry is around 7.6 billion.
Correct, yes.
So we just need a list of this has been paid. These ones have not been paid, but already negotiations have been done with the costs, agreed amount of payment. Because as you explained about this reverse, there was delivery and then people negotiate for the prices. So we need to know the list of those who have negotiated already, how much it is, and then the ones who have already delivered and not negotiated. So that means it's blank because you have not agreed on how much you're going to pay them.
Understood. We'll make plans to have them printed and sent over to your office.
Okay.
In that format.
I would like to have that format. I want to open it to the plenary. So, honorable members, anybody with a comment or question? And there are some documents Magut has shared on the group, so you can be able to access to them. That's Dr. Eseli. And then I'll go to Honorable Wino, I'll go to Honorable Dagala, Captain Ruwaida, in that order, and Professor.
Thank you, Chair. You said you had some budget and whatever, but I noticed that when the ministry was here, there was a time KEMSA actually went directly to Treasury, bypassing the Ministry of Health, which is your mother ministry. I think looking for additional budgetary allocation. How did that come to be without going through the mother ministry? Then, as you gave these commitment letters, were you looking at the usual suppliers that you have been dealing with, or would anybody walk there, even a construction company, would walk there and get a commitment letter? Because it appears like that's what might have happened. When you look at the companies that supplied materials, some of them, their line of business is not healthcare at all. And any company appears would have been able to get a letter of commitment to supply anything. I think those letters of commitment, even if this was an emergency procurement, I think the procurement department should still have been in charge of this procurement. I don't know how far that department was involved in this procurement, including giving commitment letters and so on and so forth. And then you needed emergency procurement at the beginning. But see, this pandemic might be with us for quite some time. So was it justified, apart from the initial emergency procurement, was it justified then not to do the usual tendering for the rest of the supplies so that you get the best prices? Because this pandemic is going to be with us for quite a while. And from what the chairman explained to us, you have quite a lot of stock of these COVID-related commodities. Wouldn't it have been wiser to do the initial emergency procurement at that time, then go to the usual tender for the rest of the supplies? Thank you, Chair.
Thank you. Owino?
Thank you, Chair. Chair, thank you. First of all, I want to appreciate the KEMSA for the role it was initiated to do which it has tried to do. But I want to also bring to your attention, especially the chair of the board, that this is a state corporation, which is acting under Cap 446, that is the State Corporation Act. In that act, there are three parts of involvement here. There are things that you cannot do until the parent ministry reviews, and that is the estimates, annual estimates, and the budgets. And I think Dr. Majari alluded to this. Even if the Treasury says you have a surplus, it becomes an estimate immediately the annual year begins, and you need to go through that loop so that the ministry can also give a nod. Now, having said that, there is also a part in this tripartite arrangement, and that is the role of the board. And Chair, if you allow me, under the State Corporation Act, the board shall be responsible for the proper management of the affairs of state corporation and shall be accountable. When we talk of accountability under that act, section 15, is only the board which is accountable for the monies, financial, business, and management of the state corporation. So I want to ask the chair directly, did your board approve the over-expenditure? It's not a matter of minutes. It's something you can remember very well if your board approved that amount of money. In that same section, actually, it just says the CEO can be just someone to explain. But the accountability rests on the board. And it's not just giving direction, no, the approval. After the ministry, in consultation with the Treasury, has given okay, and which goes around through even this House, then the whole affair of running the corporation is on the board in terms of approval. So I need a straight answer to that. Very, very short. It's a yes or no, whether you did approve or not. Then you have a technical person in the procurement who should understand the procurement for procedures, reversal, you direct or restricted tenders. That's why that office is there. So I also want to ask directly to Juma. Knowing the procedures, why did you overcommit beyond the budget? Unless, and I need this clarification from the chair too, there was initial budget that was approved at the beginning of the year. But because you didn't foresee and nobody foresaw COVID coming, you are obliged to do another budget. Did the board approve the second budget, which was more than what you had? And if the board did not specifically approve that budget, then Juma, you're on spot again. How did you allow the corporation to commit what they didn't have in that annual year? Lastly, Chair, having said the role of the board, it is kind of unique to me. If the accountability rests on the shoulder of the board and there is a fraud suspicion, how does the board stand up again because he's advised by the EACC to suspend the CEO? I know you could say they asked us to do it, but I've just read the act, and in fact that is why this House is here. If there is any conflict between KEMSA Act and State Corporation Act, we can iron it very fast. But here, the accountability of the financial management rests on the board. And here is the board suspending the CEO, who is just a member of that board. So do you even have a legitimate reason to be there as a board if you're being suspected to have incurred irregularities in the procurement? Thank you, Chair. I rest my case.
Captain Rueda.
Thank you, Chair. Mheshimiwa has asked the board. Mine, I'll ask the CEO. Dr. Manjari, you indicated that there was undue influence from outside on the tendering process. As the CEO of KEMSA, why didn't you tell the authorities like EAC or even the appointing authority about the external interference rather than falling for the same rubber stamping and approval which you knew would raise questions on integrity? Second question is to the representative of the PS. From the presentation of the PS yesterday, it seems like you don't inform the PS before things happen in KEMSA. So what is your work there? Thank you.
Honorable Koros.
Thank you, Chair. I think I have about 3 questions. One, to the Chair and the CEO. Who authorizes the expenditure of the 7 billion? We really want to know clearly. Did the board authorizes the over expenditure, or it was just the work of the CEO? Secondly, Chair, we would also like to know the criteria which you use to identify companies who supplied you with COVID items. Thirdly, Chair, I want to ask the CEO, what was your relationship with these companies? DK Relief, Dominion, Suppliers, Everia Distributors, Comtel, Kenya Limited, Makerscope Healthcare, Shop and Buy Limited. Again, Chair, I would like to know from the CEO, why were there favorism in terms of payment? There are companies who were paid immediately as they supplied goods, and there are those who they have not even been paid up to now. Another question, Chair, to the CEO and the Finance Director, KEMSA. How much money did you or have you received from Treasury directly, not from the Ministry of Health? Are there any monies you received directly from the Treasury? And then, Chair, there's this thing I don't understand from the procurement department, this thing of negotiation. Where on earth can someone supply goods and then later on, after they sit down, they negotiate for prices? Isn't that corruption of the highest order? I think I raised my case there, Chair. Oh, last one, Chair, sorry. What was the role of KEMSA in Jakma donation distribution?
Honorable Adagala.
Yeah, thank you, Chair. I just wanted to ask some clarification here, 1 or 2 questions. I just wanted to ask the CEO, KEMSA, did you oversee the loss of public money at KEMSA? Yesterday, CS Kagwe was here, and he said that there was no money has been lost in KEMSA. Do you hold the same position? Okay, during the tendering process at KEMSA, did you ever receive instructions from anyone in executing your duties, mainly on awards of tenders to purchase COVID-19 materials? If yes, from who? In what context were the instructions meant? I'll still also ask the same question that has been asked. Did the board approve the 7 billion estimated budget? Thank you, Chair.
Thank you. Those are quite a number. I would ask I take a second round. So we first have those submissions, and then we'll take a second round. And on that order, we can start. I think, Chair, your questions are not many. We can start with Chair. We go to the CEO, then we'll also go to procurement. Chair.
Thank you very much, Madam Chair. The first issues were actually raised by yourself on the surpassing of the budget, 4.6 billion to 7.1 billion. You asked who authorized the budget and how do you propose to make the money. First and foremost, again, I believe I answered that question the last time, and I did say that the board did not authorize the budget passing from 4.6 billion to 7.1 billion shillings. And I think that's clear. And I'm sure that Dr. Manjari is going to be able to explain that. On the issue of 758 billion shillings, I have explained it. Dr. Eseli has raised the question of KEMSA writing directly to the National Treasury by passing the MOH. The letter was written by the CEO, Dr. Manjari, and he is here. He is going to explain that.
Chair, maybe as you answer that question, you can just clarify, were you aware about that letter?
You notice that letter is not copied to me, Madam Chair. I came to know about it subsequently. Madam Chair, on the issue of the State Corporations Act, the role of the board, it has been stated that our responsibility is not just to give general where the matters that it has directed on have gone wrong. The question was, did the board approve the over-expenditure? And I've explained now and last time that no, the board did not approve the over-expenditure. Indeed, that issue did not come to the board until much, much later, I think in August of this year, when the management brought to the issue of having surpassed the budget by 7.6 billion shillings. I think it's also important to note here, Madam Chair, in the committee, that these COVID procurements were done between mid-March, mainly in April, May, in March, April, and May, a very short period of time, Madam Chair, when the commitment letters were issued and when the commodities were delivered to KEMSA warehouses, where I confirmed those commodities still are the ones that have not moved. A lot of them, of course, have moved, but 6.2 billion shillings, as of the last time I was here, is the amount of money that is still there. So in taking responsibility, I want to state that the board did not approve of that over expenditure, and that has been confirmed. Then the same honorable member of parliament asked, because he's talked about suspicion, he asked, why did we suspend the CEO and why is the board still there? Now, I did produce as one of the annexes the letter dated 13th of August from the EACC, the letter from the EACC to myself, copied to the CS and to Dr. Kenyua, and also to the PS, Susan Mochache. Madam Chair, these are investigations that are ongoing, and I've stated that what is being said against the 3 officers who are on suspension are allegations. And the allegations against them are this: that the Commission, pursuant to its mandate, commenced investigations into allegations of irregular procurement of COVID-19 items by KEMSA Medical Supply Authority, headed by Dr. Jonah Manjari, the Chief Executive Officer. Preliminary investigations have established that several senior officials at KEMSA engaged in regular procurement of COVID-19 items. Now, these are allegations. All these are allegations. And I've said it and I'm on record that maybe Dr. Manjari, Mr. Charles Juma, and Mr. Eliud Mureithi will be able to explain themselves on these issues. Maybe they'll be able to talk about having procured in good faith, like Dr. Manjari has said, because there was an emergency and nobody knew the extent of COVID-19. Maybe they'll be able to show that what they bought at was the prices they were buying at that moment. And Mr. Charles Juma has stated clearly that even as we were buying a PPE for 9,000 shillings, it was going for 12,000 shillings out there. So maybe he'll be able to explain and to say that the allegations being made against him as procurement director or against the other officers are not true or founded. And maybe they'll be able to show that there was no double pricing of these items as has been alleged and stated out there in the public domain. And that is why this hearing, Madam Chair, is so important.
Point of order. Point of order, Chair.
What is out of order?
Is the Honorable Senator in order to misread this Honorable Committee on the matters of pricing? This committee is aware that in matters of K95 protective masks, there was a company that was selling at 200 shillings. Yet, in many of those other companies that were given the tenders, they were given at a price of 700 shillings.
Honorable
So
Chagagwa.
is he in order to misread us that the procurement director had the best of interest of Kenyans? He did that in good faith. When we are aware that there's a company that was selling at 200 shillings, and yet the majority of other companies were given at 700 shillings.
Honorable
per piece.
Chagagwa, I'll allow when it comes to the submission, the procurement person to answer that question. So I'll take it up as a supplementary question so that then we'll make a decision whether it was misleading or not. So procurement, I think there's that document, specifically where some companies were cheaper, given fewer commodities, and others were more expensive and given more. So you just take note. You'll be able to respond to that. Honorable Chair, you can proceed.
Yes, thank you, Madam Chair. Madam Chair, I am not misleading the House, and if Honorable Jagagwa, with the greatest respect to him, listens to me, I've used the word maybe. I said maybe they will be able to explain themselves. Maybe they'll explain how one person was selling for 250, another one was selling for 900 shillings. So these are allegations as of now. And should the EACC come back and tell us that they have nothing against the three gentlemen, we shall be obliged to take them back at KEMSA as a board. Should they be charged in the court of law, then there shall be consequences, Madam Chair. So those are issues, those are allegations, they are matters of conjecture, and at the moment, Madam Chair, with the greatest respect, they remain just that. So when the honorable member asks, why is the board still in place? It is because the board is not being investigated as of now, at least. The board is not being investigated. It is its management of KEMSA that is being investigated, and we hope that this will end as quickly as possible so that we may know exactly where we stand. So on the issue of 7.6 billion shillings, I have said what I have said. On the issue of 758 million shillings that, Honorable Chair, you had raised, I had requested that you allow Dr. Manjari to explain it. But on the basis of what I said, that my understanding is that the figures attached to that list initially came from KEMSA, not from the PS of Ministry of Health. I think those are the issues that were raised directly with me, Madam Chair.
Thank you, Chair. I'll go to the CEO.
Yeah, thank you. I wish to start by explaining the 758 million, the letter and the attachment that was sent to KEMSA. As we had said earlier, we concluded retrospective procurement for the items that are attached. And I wish to I don't have that letter, but I can recall that we had done retrospective procurement, we had done negotiations, we had given commitment letters, and all that had been concluded. And is at that time, from the 1.1 billion that we had been told that would be accessible, we forwarded that list with that request to be given those funds, and those funds were coming from World Bank. After that, the World Bank sent their representatives who work at the Ministry of Health, and they came and audited. And so far, from that list, by the time I was being suspended, we had paid 305 million, and the balance was to be paid as they authenticate those supplies and deliveries as was attached in that list. So that list indeed had come from KEMSA, and we had forwarded it to the PS. We were not instructed to procure those items from those suppliers, as it had been alluded earlier. On the aspect of the letter that I wrote to the CS National Treasury.
Just hold on, Dr. Manjari. On the same letter that, now that you have said it came from you, I think then that answers the question on the attachment. I have the file here of procurement of masks. And so they were in the same letter, there were some companies that were selling, to be specific, meds at 250 shillings. And then there were others that were selling between 700 and others 900. How was that possible?
As we had stated during the submission of the procurement director, we need to appreciate that most of the COVID items were not stock items in KEMSA. And the N95 before COVID was only being used for the management of patients by the clinical officers, doctors, and nurses when they are treating the patients who have TB that has multiple resistance to most of the drugs that we use, what we call MDR. The company that had been given a framework contract told us they will only be able to supply us of that commodity in the month of July, so we could not go to the framework contract. On the N95, as it is indicated in that list, we did get small quantities at that time in the beginning, and those are the quantities that were taken to IDH in Kenyatta, and we sourced them through retrospective procurement from meds. And after that, as you are aware, there were no other supplies that were coming, especially for N95, which was coming from the US and is a product from 3M, a company that supplies that commodity. So we had to start looking at alternatives, and that's why the prices started going up because of the demand and supply. And Madam Chair, we then could not get or access the 3M products, that is the N95. And as you are aware, you would see when you walk around in the hospitals, the doctors, none of them is wearing 3M, N95. This product is also in short supply even in US. And that's why we went to an alternative, that is KN95. And the 95 that is mentioned there, it is the protection rate or the filtration rate and protection to the clinical person who is using that product. It is up to 95% assurance that is protecting you. So that's the reason we only bought or mopped out what was in meds and other people who had those products, and we transited quickly to save this country to KN95, a product that was coming from China.
Okay, you can proceed with the other answers.
So on the letter to the National Treasury, it is indeed a letter, a replica letter that I had written to the PS Health, seeking for support or budgetary support to KEMSA for the amount that was mentioned to 5.3. And we were made aware in very many correspondences that were even in the media and the rest that the National Treasury had a budget for COVID-related items. And it's in that, on the background, that I wrote that letter in good faith, seeking for support, and I copied my PS. So that letter is...
Madam Chair, point of order. Point of order, Madam Chair.
What is out of order, Honorable?
I'm just wondering whether our very good friend, Dr. Manjari, is in order to you know, in relation to the PFM Act, Section 30, and again in particular in relation to the Procurement and Disposal of Goods Act 2010, I think Section 9, it is very clear that an accounting officer shall not commence any procurement proceedings until satisfied that sufficient funds to meet the obligation of the resorting contract are reflected in the approved budget. Now that leads me to my point of order, Madam Chair. Is the CEO in order just to mislead us? We sit here, listen to narratives which are misleading, when we know the law is very clear that any procurement officer cannot commit any public body on any contract when there is no money. It is not a matter of conjuncture. It is a matter of an act, a regulation of Parliament that says that before you commit any entity, there must be money. So when he tells us that there are assurances from the government, there are press conferences, is he in order just to lie to this honorable committee? We may listen to stories, but on matters of fact, on matters of law, if he is not conversant with that, then let him wade off clearly out of that lane. Thank you, Chair.
Thank you. I think, Dr. Manjari, you can just explain what Honorable Jakagu has raised.
So as I had said earlier, the approved budget was 4.6 in the budget estimates, and that actually had been approved by the National Treasury through the National Assembly, and that is the position. But as it had been explained earlier, we did not have a budget for COVID-related items. But several bodies have pronounced themselves that they have the budget. So we never accessed that budget. And that's the reason we are seeking for budgetary allocation. And it is also provided for in the emergency situations that mobilization through contingency fund can be accessed. So we were hoping that that will come from that direction, Madam Chair.
So, Madam Chair. Madam Chair.
That's Honorable Kutuni.
Yes, Madam Chair. So, you know, very interesting how Manjari is putting his case. You know, he appears harmless, but he can be the green snake in the green grass. Very dangerous. You know very well the procedure and the protocol is there. Clearly, when a CEO. So if I put it to you that you admit mistake by contravening the procedure and the process and bypassing the ministry by writing directly to the Treasury, and then 2, overspending beyond the budgetary without the approval. The body is here, and they've stated clearly that they did not give you mandate. In the communication that is here, you never wrote to the board again saying that we are seeking your advice. You never wrote to the chair seeking advice on the same. So it means that you went and you did your own things, cooked your own figures, concluded on your own awards, and bypassed the board, bypassed the ministry, parent ministry, and you went straight to Ministry of Treasury. So then you can escape all the questions from the ministry and the board. And it brings us now to the question that you are on suspension because of that. You are being investigated because of contravening the procedure. And then 2, overspending beyond the budgetary. Do you admit that you did a mistake? Thank you.
Madam Chair, as we had said and we have submitted severally, we are doing a retrospective procurement. At no one time did we envisage that there won't be a budget. So our commitment was to have adequate supplies of COVID items, and we gave reports of how far we have reached, and we were hoping that that budgetary allocation will come. And as I had said, Madam Chair, the 4.6 was approved. And since we do operate a revolving fund, it is true that we did not have an approval, and we sought approval, and that's how these reports came about. And we sought approval to the PS to utilize extra funding, and we did make a report to the board. And at that time, by the time we were closing the financial year, we did say that we have a payment policy which is between 30 to 90 days, and some supplies had come to us, May and June, and if we were to follow that protocol, we'll be paying them in the month of August and others in the month of July. So, Madam Chair, we did not do this to, as it has been put, within a mischief in mind. I want also to confirm I'm not a green snake in the grass. I am an honest, passionate medical profession of high integrity and practice. And as it had been put, I have no relationship with the said companies that were mentioned. I can't remember all of them. There was Comitel, Megascope, Shop and Buy, Dominion, and everywhere. If you look at their CR12, none of my relatives, myself, are directors of those companies. And as it had been said or mentioned, I want to submit to this House that we had no favorism in payment of any company, and these companies that were paid after the process had been concluded. And those who have not been paid have been paid because, one, the process has not been concluded in negotiations, and we did not have the conclusion, and we are hoping to pay them within the year of 2020-2021. The issue of whether I want to confirm to this House the statements that were made by the Honorable Cabinet Secretary that no money was lost. Under my watch, as a CEO in KEMSA, no money was lost, and I did not oversee any loss of money, because to my recollection, to my conviction, my conscience is very clear that we did not have any loss of funds. All commodities supplied, they have been utilized as a manner that will give reports, and the stocks are available for the commodities that have not been utilized. They are intact, and the acting CEO, who has access to those documents, can table them in this House. The other question that was asked was the criteria used to identify companies. The criteria was and required an emergency drug. I'll only go to the person who has it, irrespective of the cost. I'll be seeking to save his life. The same thing happened. It's not an issue of whether it was a construction company, whether it was any other related company. It was an issue. Did you have that commodity that we were seeking? And if the commodity met the quality that we have been advocating for in KEMSA. I have also been tasked to mention or to confirm on the issue of the pressure. As a CEO, I did not work under any pressure whatsoever. As I said, I did this with my eyes open.
Point of order again, Madam Chair. It's unfortunate, but you know.
What is it, Honorable Jagagwa?
I may not wish to relay Bwana CEO from his line of submissions, but I'm certain my good friend and honored senior, Senator Kembi Getura, will tell you that before I go to my point of order.
You are what?
Before I go to my point of order.
You want to do what?
I want Senator Getura to confirm what I'm saying, that when companies are registered, they are registered for a purpose. And you file what we call a memorandum of articles, memorandum and articles of association with the Attorney General. And inside the memorandum, you state your objectives or the objects for which the company is registered. It is on the basis of your objects that you do your trading. So you cannot be in a car hire business or running tourism hotels, and then you purport to be selling COVID-19 related items. So is the CEO in order to tell us that they could buy from any company so long as they have the items? Well, we know there's the memorandum that guides the company, and I would wish even senior to confirm that you do not just do business without not restricting yourself to the memorandum and the articles. So is a CEO in order to again just throw words and mislead this committee?
Senator Getura, would you wish to
engage
Honorable Jagagwa on that line?
I don't know why he wants to engage me on that point. But I can also remind him that a company can have as its main object car hire business, but inside there have very many other objects for which they are formed.
Fine, we'll get.
And you may want to look into that memorandum and see whether in there, among the very many of them, there could be just one clause allowing them to engage in trade. So I think.
Well put, Senator. We'll get to that.
No, but you wanted a clarification, Honorable Jagagwa.
We'll get to that.
I'm trying to give you a clarification so that the House is, if you want my opinion, the House is not misled under the guise that I'm the one who gave that opinion.
Honorable Jagagwa, we would be interested to know your relationship with the senator. You seem to like pulling his leg or engaging him a lot. But that is a matter of lawyers, so we'll rest it there. Honorable Dr. Manjari, would you proceed?
Thank you, Madam Chair. And finally, I would wish to comment on the question that was raised earlier on the commitment letters. These commitment letters were given during this unprecedented time, and most of the items we could not go to our pre-qualified suppliers or the listed suppliers or registered suppliers with KEMSA because they were not stock items. I would wish to point to the House the issue of the nitrile gloves. We didn't have a framework contract, neither did we have a supplier who could supply that. The PPE. The PPEs, as you, the PPEs were not stock items in KEMSA, and the only other time we used PPEs was during the Ebola emergency. And a few suppliers whom we contacted at that time had excess or remnants of what had been left after they supplied the government during the Ebola time. So we did this in consultation with the procurement director, and a question was asked whether we'll continue engaging in emergency procurement for COVID, since COVID is already with us. I would wish to say that we have since even advertised for COVID-related procurement under Global Fund, amounting to 517 million of the 5 items, and the evaluation of those procurement is ongoing. And once it's concluded, my teacher, Honorable Eseli, I would wish to tell you and confirm to you humbly that the prices that will be reflected after the conclusion of that procurement that we are undertaking currently will be the benchmark that we'll be using to continue going forward as open default method of open international or national tender, as the case may be. We are also being guided and following very closely through the modeling that is being every day given by the WHO, the Ministry of Health, and we are glad that we are flattening the curve. But the frontline health workers are still at risk, and these commodities, we want to give assurance that we have adequate stocks, and these stocks will be continuously used to protect the health care workers in this country. If there is any question that I've not touched on, I would wish my procurement director, colleague, and the finance director, and the commercial director to clarify on any point that I've left, because some of the questions were also falling
Chair.
for their confirmation.
Point of clarification.
What is it, Honorable Koros?
Yeah, I'm still not satisfied with this answer on the companies which I asked, Chair.
On the?
On the companies which I asked him to give us details, because I know 2 or 3 companies everywhere. DK Relief, Angelica, Panaceo, please tell us the truth. And who are the proxies who are using these companies, whom you're always meeting and they're always calling you?
As he answers, if you have any evidence, Honorable Koros, you can also table the evidence.
Chair, I have evidence, Chair.
Okay, you can table the evidence. So as CEO answers.
Thank you. As I said earlier, I don't have any relationship with those said companies. Angelica, DK Relief, Shop and Buy, Megascope, Comitel, everywhere, and the other one, I guess he mentioned everywhere, and I'll also be as keen as you are to see the evidence that will be tabled, Madam Chair.
So you'll approach the chair and table the evidence if you have it, Honorable Koros. Let's proceed to Mr. Juma, procurement. And having looked at this document, I think as we pick from there, we only see 2 communications, one on 15th April 2020 on the procurement of goods under the contingency emergency response component, and also another one on 13th May, authority to undertake procurement of health products under Global Fund grants. Do you have any other letter giving you authority to procure goods under this emergency?
Yes, Honorable Chair, that I can be able to confirm, and because I don't have access to the office, the acting director can be able to provide authority letters from the others from the Ministry of Health, from the PS.
So was there any other apart from those 2?
There was one for procurement from buyer sensor. I think I can remember.
Okay.
The vote on that. But I just want to inquire, Mr. Juma, do you have an email access where you are corresponding through emails as well? I mean, you can't just claim easily saying that you don't have access to the office. You might have access to your emails as well. So there must be other forms of communications that you've been doing between yourselves and the ministry.
On the matter of the letters which we received from the ministry, there were hard copy letters which were addressed to the CEO, received in the CEO's office and marked to procurement. Those ones can be provided, Madam Chair. The letters are available. They can be provided.
Chair.
Proceed.
Chair.
Yes.
Could we allow him to proceed and then we can intervene?
On the same, Chair.
On the letters?
Yes, Chair. You remember the last time KEMSA management came to face this committee? We requested as a committee for them to avail to us all the documents pertaining to COVID monies expenditure. Chair, as a witness, we didn't receive any of those documents, which shows they was telling Bwana CEO all along, this CEO has never wanted to work with this committee. And that's why, Chair, even when we requested for important documents, we didn't
Honorable
get,
Koros, I
Chair.
think you're out of order. We are talking about an acting CEO. There's a suspended CEO.
The suspended CEO, Chair.
But he cannot provide documents on behalf
No,
of
then we
KEMSA,
had
so-
requested even then before all this scam came, Chair.
Okay, that's on a different then agenda, but the acting CEO would require those documents, what Honorable Koros is alluding to. They can come together with the other documents we had requested earlier.
Noted, we stand guided.
Thank you. Proceed, Mr. Juma.
Thank you, Honorable Chair. On the question which was asked by Honorable Dr. Eseli, was procurement involved in all issuing of commitment letters? I want to confirm to this committee, yes, we were involved in the commitment letters, but not all of them. All the Indian letters from the suppliers were addressed to the CEO, received in the CEO's office, and marked to procurement. But I want to confirm to this committee that there are a few letters which were handled in the CEO's office. They were processed and commitment letters issued. So procurement was not involved in about 9 commitment letters. It came to our attention only when delivery had been made to White House, is when we knew that commitment letters had been issued to the suppliers. So, but all the others, we were involved from the word go.
So you have the list of those 9?
Yes, we have a list of those 9, including the one, I think, which has come so clear in the media, the Kilik Limited. The Kilik Limited commitment letter for 4 billion. I can be able to confirm this committee that procurement was not involved. We only came to note of its issued letter, and I brought to the attention of the CEO advising that that commitment letter should be cancelled or revoked. I have an advisory which I wrote on 4th of June to the CEO.
You have that
I have an
document
advisory.
too?
Yes,
You will
yes.
table those two?
I have an advisory.
Yeah, but we'll come back to you, CEO, to explain about that.
Yes.
So proceed, Mr. Juma.
On the question asked by Honorable Owino, that having a technical person in KEMSA, knowing the procedures, why did KEMSA overcommit? I want to bring to the attention of this committee that we knew that the budget for health products and technologies was 4.6 billion, and therefore when we were issuing the commitment letters, we were aware that we were not supposed to surpass that budget. On 21st of April, we had a senior management meeting, and I brought to the attention of the committee that we had reached 3.9 billion. And therefore, I advised that we should be able to stop further issuing of commitment letters. And that meeting, it was agreed. The CEO was the one who chaired, and all the directors were in attendance. We agreed that we should not be able to issue any further commitment. But then the issuing of this commitment letter continued, and therefore, on 24th of April, 2020, And Honorable Member had asked, did procurement provide advisory in writing? I did provide advisory in writing. And in that advisory, one of the things I had indicated that all procurement should be within the approved budget. And therefore, in this advisory that I gave, I indicated that we had reached a budget of 3,996,636,560. And my advice to the committee was that we should stop any further issuing of commitment letters. But then I think it continued. So I have an advisory in writing. And on 15th of May, I issued another professional opinion advising senior management that we had adequate quantities of 12 items, that is surgical face masks, K95, K99, N95 with the respirator, personal protective equipment, face shield, surgical gloves, nitrile gloves, pair of goggles, infrared thermometers, instant hand sanitizers, and ventilators. And in this advisory, I indicated that we should put on hold any new direct procurement, because at this particular moment, the procurement of COVID item had surpassed the budget, and we had reached a budget total commitment of 5,324,481,200. We had therefore surpassed the budget by 668 million. So in this advisory, I advised that these items which I indicated in this opinion, we had adequate stocks and there should be no more procurements. And the last advisory I gave is on 4th of June, 2020. And in this advisory, I advised that the procurement of COVID had reached the tune of 7,699,260,500. We had therefore surpassed the budget by 3 billion. And I was advising that based on this procurement and also on what was at place, that we had already surpassed the budget. And I also indicated in this advisory or opinion that it had been brought to my attention that there was a commitment letter to Kilik. And in this, I advised that this commitment letter to Kilik was worth 4 billion. And therefore, its commitment should be revoked or cancelled, because this will amount to a budget for a full financial year. And I had other recommendations which I made to the management. And number one was with regard to commitment letters with a deficit budget of 3 billion, that the fund or budget to meet this resultant expenditure be availed or this procurement be deferred to financial year 2020-2021, as the CEO had indicated. That the commitment letter issued to Kilik Limited should be cancelled, revoked with immediate effect, as this procurement does not meet the threshold of Public Procurement and Asset Disposal Act 2015. I had indicated that this procurement should be conducted through a competitive process. That any continuation of fulfillment of this commitment letter will amount to a breach of the Public Procurement and Asset Disposal Act 2015. The third recommendation I made was that there should be no more issuing of commitment letters to prospective suppliers. Any procurement anticipated should be planned for and carried out in accordance to the Public Procurement and Asset Disposal Act 2015 through open tendering, as a member just indicated, because we had already adequate stocks of a number of these items. And number D, I indicated that Quality Assurance Department should be advised to stop any further evaluation of any samples, as this is giving prospective suppliers false impression that we are still carrying out emergency procurement. That procurement will only, the last recommendation was that procurement will only retrospectively process procurement for commitment letters in its custody. So I have 3 advisories, and the last advisory I did was when I received a letter from the CEO with regard to Kilik Limited, and the comment was I discussed with the supplier, and I did an advisory to the CEO, and I advised that in line with the limited budget for COVID-19 items, and as earlier advised, kindly shelve this procurement until we have adequate finances. And therefore, I want to report this committee, as Honorable Owino had asked, did procurement, the technical person, advise KEMSA? I did advise KEMSA. That's my response to that question.
And I request you also table
Yes.
those advisory.
Yes,
Madam Chair, will you allow us to interrogate at that point, or you want him to conclude?
Let him conclude his presentation, then
Okay.
you can.
Okay.
The other question which was asked is that the criteria used. I think the CEO had responded to it. We have a list of pre-qualified suppliers for, I think, 47 categories. And one of the categories for health products and technologies is supply of pharmaceuticals. The other one is supply of non-pharmaceutical. Non-pharmaceuticals involves procurement of all items that do not fall on pharmaceutical. And therefore, when we are carrying this procurement of COVID items, we agreed that any supplier who had been registered for supply of non-pharmaceutical could be able to qualify to provide an indent letter for supply of the COVID items. The other question which was asked is that, Honorable Chair, is that what is this called negotiation? I want to bring to the attention of the committee is that when we carry out direct procurement, is that even in the normal situations that when you carry out direct procurement, you will invite the one bidder that who is supposed to supply the item. The bidder will supply a bid. The CEO will appoint an ad hoc committee to negotiate with the supplier, agree on a price, prepare minutes, submit to the director of procurement, who will prepare an opinion for the CEO to award. In this case, when we are doing COVID procurement, which was a retrospective procurement, once the supplier delivered the item to KEMSA warehouse, it was a requirement that we follow the same procedure because we are doing what we call it formalization. The prices which the bidders had indicated earlier in the letter was not a final price. And the indication was that the price you have indicated will be negotiated to acceptable price. So that was the essence of a negotiation team. And every item direct procurement that we issued to the COVID-19 suppliers, we had a committee negotiating with the suppliers, where the supplier, for example, indicated for KN95, their price was 980. The committee will be able to negotiate and inform the supplier to that the best price they can be able to offer or allow is 700. We have instances where the suppliers, for example, I remember a case where a supplier insisted for supply of thermometers. They could not supply the thermometers at a price which we had agreed maximum 10,000. They said they will only supply at 12,000. And the committee deferred and called them again to go and rethink. And the supplier came again, I think twice, and later agreed that you can be able to offer the item at the price of 10,000. So why we gave what we call it the maximum limit is based on the market survey and based on the bulkiness of the commodities we are buying. So we are ensuring that we are getting value for money we were procuring. And the other question which was asked by Honorable Chagagwa is that why KEMSA bought an item, K95 or N95 for 250. I can be able to report this committee that initially we had reached out to MEDS. And MEDS indicated to us that they had 1,000 pieces of this item from their old stock, and they could be able to avail it to us. So we agreed to buy the 1,000 items from them. And the price they're offering at then was 250. If you confirm with the MEDS, after that one, their prices, which they bought the new commodity, it also went up. So therefore, when we went to the market, the only available price, the best price we could be able to get, the K95 was 700. Yet in the market was 900. And therefore, that's why I can be able to explain the difference between the 250 and the 700. It was what was in stock previously at MEDS against what came on board during the COVID time. And Madam Chair, that's what I can be able to submit on the question which you asked.
Thank you. Do you have a
clarification?
Clarification.
Yes.
And as we start, you talked about maximum limits.
Yes.
So now for the ones who have, what would happen? I think I just want to let this committee happen. You've given us an example of those, the ones with thermo, or the thermograms, and you couldn't agree on price. You told them to go rethink. If they insisted on 12,000, what would have been it? Would you have just offloaded their things or the items from their warehouse, you give them back, or what would have happened?
To respond that we'll never reach that situation, but then we will have agreed with management because a number of those items had not gone outside, had not been issued. Some of them were still in stock. So we'll be able to inform the supplier the consequence is that beyond a certain price, because we'll be buying an item beyond the market price. So either the management will be able to give an approval to release the commodity back because it had not been, the procurement process had not been finalized.
So the negotiations are as per the market price by
the
time of negotiation?
Yes, yes. But not at the time of you supplied the item. You supplied the item at April.
Yes.
And the market price then for a K95 was 700.
Mhm.
The maximum price we'll be able to allow is 700.
Okay.
But if you get a better offer, we'll take it.
Okay. Honorable Kutuni?
Yes, Madam Chair, thank you very much. Director of Procurement has explained, taken us through on the procurement process. But clearly you've indicated that you raised the alarm on 24th, should have been, I think it's 24th June or July, when you did the first advisory to the management committee, which I suppose it was supposed to, it is chaired by the CEO, who is here. You've gone further, that upon advisory, that you are at 3.9 billion, you are advising that you stop the procurement further because it was surpassing the budget. I guess that is what you're trying to tell us. But then somebody disregarded your advice. Again, after 2 weeks, you did another advisory to the same management committee, which I suppose all of the management committees are here. At that time, the budget had busted to over 4.7. And then there was another third advisory that you did. The budget at that time was 5.6 billion. You appear to be a very honest person. But something that you are not telling the committee is that if you were ignored, what action did you take? This is an organization with organogram. If there is any problem at the senior director position of yours, if the CEO is ignoring you, you had the responsibility of reaching out to the chair and raise the concerns. And then the question is, why, despite of all the challenges that you are facing or going through, why, at the point when your advisory was being ignored, why don't you take the action and report to the board? And I will put it to you that perhaps maybe you are trying only to be clever, knowing very well that you've already committed a mistake. And the only way to do is to prepare for a defense. So, Madam Chair, I would want Mr. Juma to confirm to the committee that whatever he was doing at that time was not a cover-up, but he was being frustrated by the so-called management committee. Thank you.
I think
Juma, you can take like 3 questions. I'll go to Honorable Jagagwa and Honorable Wino and Professor.
Thank you, Madam Chair.
Senior, I'll come back. I'll come to you.
But,
proceed.
Thank you, Madam Chair. I'll just pick it from where my colleague Vice Chairman has left it. My opinion, and this is my opinion, is that the Director of Procurement is being mischievous. I was being mischievous by his advisories. The reason is this, and that's my statement, Madam Chair.
Honorable Jagagwa, kindly put up your mask.
Thank you.
Thank you.
If you look at all the letters of award to any given entity, they were never signed by the CEO, Dr. Jonah, but they were signed by Charles Juma. All of them. I have my file here, and there's not a single document that is signed by Jonah Majali. My statement is that what Juma is trying to do is throw the CEO under the bus. My statement again is that at this point in time, you now know that you are alone, and God follows all. So why did you have to sign all these letters knowing that you were overcommitting KEMSA? Yet on one hand, you write your advisories. On the other hand, you sign the award letters. That is actually conflicted personalities. Or even double speak, assuming you are speaking. But by dint of your letters of award, you're actually doing a double speak or conflicted personalities. That is one. Number two, and Madam Chair, if you may, with your kind permission, that is why I said when we had a discussion with my senior that I'll get back to issues of award letters. There is a matter that I raised yesterday, and I raised it with the KEMSA board when they were here. Juma is by no means, he is well versed in matters procurement. That is why he's a director of procurement for KEMSA. There's a company called Lego Freighters. It is, when you go to the list of directors or the certificate of directorship, it is actually a business name whose sole business, as authenticated by this letter from the director, by the Register of Companies, is to carry out the nature of clearing and forwarding. Then how did he have to award them? How did he have to award Lego Freighters the tender for the supply of surgical masks, 60,000 pieces, amounting to 270 million? And these are people who should be carrying out the business of clearing and forwarding. I will refer him to Article 227 or 227 of our Kenyan Constitution, which says that public funds must be well utilized. Again, I will also refer him to what we are calling Section 30 of the PFM Act, that you cannot commit an entity, and you are the one who is committing, not even the chief executive, it is you, by your hand. You are committing that entity. I don't even think you have the powers to commit the entity. Procuring goods outside the budget that has been approved. Madam Chair, if you look at, again, Section 53, 8 and 9 of the Public Procurement Act, again it says you cannot commit when there's no money. So I put it to you, Bwana Juma, that your actions have actually brought Mr. Manjali on this floor. You have visited you by dint of your hand of a commitment. Your actions have visited the unfortunate events that you are finding Daktari in. In fact, I saw yesterday, and that leads me to my third question, Madam Chair. There was correspondence which was brought to us yesterday by the CS. The CS, Honorable Mutai Kagwe, and the PS, Mochache, Susan. There are clear letters from, I think, the director, Mr. Muredi, commercial director, where he is advising that they should not be doing more procurement. And now again you find Mr. Muredi here, by dint of Juma's actions. He's the one who has made this gentleman to be kicked out of the office. Madam Chair, again, if you look at the letter, now that will bring my question to the chairman. If you look at the letter from the Ethics and Anti-Corruption Commission of that 13th August 2020, it clearly advises the board to have these three gentlemen out of office to read for investigations. But Madam Chair, you heard Mr. Morelli speak for himself. And there are correspondences from Madam Ochache, the folder that was brought to us yesterday by Madam Ochache and Mr. Kagwe, Honorable Kagwe. There is nowhere, and you've heard Mr. Morelli explain himself out, there is nowhere that the commercial director is involved in procurement. So then, Honorable Chair, why send a gentleman who is not involved in procurement, whose only duty is to receive goods that have been procured, away from office? I think for now, Madam Chair, no, I will also ask Juma. What kind of procurement were you doing? Was it a restricted tender or was it a direct procurement? And if it is either direct or restricted, if you go to section 74 and 75 of a direct procurement, there are conditions which are spelled out clearly when you should do a direct procurement. I've gone through those conditions one by one, and there is not a single one which talks of a pandemic, that during a pandemic you can do a restricted tender or a direct tender. You can read all of them, either in the old Procurement Act or in the current one. If you go to section 104 of the current one, they have again spelled out instances when you can do direct or restricted tender. But not a single one talks of a pandemic. So then how, and that now leads me to my question, how did you ever, as a director of procurement, advise the board, advise your senior management team to go for direct tender or direct procurement or restricted tender, when the act is clear that these are the instances, 7 of them or 5 of them, when you can do direct tender, restricted tender, but none, not a single one of them mentions the word a pandemic. So where did you get the authority to advise the board and your senior management to do direct or tender? So I put it to you, Bwana Juma, your actions, your acts of omission, acts of commission, has led to this management and the board being dragged to this house, because you indeed misadvised them. Thank you, Madam Chair.
Thank you. And members, the other team was supposed to come in the afternoon is here, so I would like we go direct to the question, so we may be able to interrogate and also have the other team. And Sergeant at Arms, because we might not be able to take a health break, if you're able to get a few snacks for the members, you can just give them to where they are seated. I can see our senior energies are going down. So, Honorable Wino, and to the point so that we can be able to wind up.
Thank you. Thank you, Chair. I'll be very brief. Kemsa, you know, I've been a very good advocate for you because I know the distribution efficiency, which I have been witnessing where I was before, up to the dispensaries. So I've been a very loyal advocate. But what I'm hearing from the Director of Procurement and also Office of the CEO, then my first question goes now to the Chair of the Board, because you hire these people. Their job descriptions, what they're supposed to do, and what they are not supposed to do. So question number 1, who is legally, according to the company policy, supposed to sign commitment letters? Is it the CEO? Is it the Director of Procurement, or both? I think that needs to be clear. Second question goes directly to Mr. Juma. You said almost 9 commitment letters you didn't know. Who signed them? Can we get copies of them to know where the problem is? Lastly, Chair, I think all these things we are gathering, we are doing so for the good of this country. So eventually, even from your standing point, Chairman, would be able to reform KEMSA, review how the structures and this tripartite arrangement, the ministry, the board, and the management, how they should work in coherence so that we don't delay, misappropriate, or lose public funds. So we want you to take this positively, that what we are doing here as a committee is to make this institution, which I love very much, function better than it is doing now, having heard how these different sections are playing each other. Thank you, Chair.
Thank you. Could we allow Mr. Juma to respond? Or Senior, do you want to go? Not to go away, just to ask a question.
Yeah, that's
so
I mean, I know what you mean.
Yes.
The senior management here is not telling us everything and actually causing themselves and everybody grievous harm. Going by what Mr. Juma said, I haven't heard the finance director make any comment. They have full information as a group, and they're making a decision which they know is not correct. And the CEO is saying he's not working under any pressure. While he was in the Senate, he actually indicated how this pressure was coming. I do not believe that people of this caliber, knowing what is right, are going to do something that is wrong unless there is a big, big reason they are doing it. So can they really explain to us why they all know as senior management, and they say they have been meeting, that these things they are doing are not really in line with procedures, and they continue to do them? As much as now it looks it's the responsibility just for the CEO. Chair, I'm not convinced they have told us through. Any one of the three of them will say that. Number two, who is the CEO answerable to? Is the CEO answerable to the ministry or to the board? And at what time does the CEO and the senior management refer a matter to the board? Even if you get an instruction from ministry or from anywhere, there is a board in place. When do they say, let this matter go before the board and the board sanction it? Does that work in that ministry? I think those two questions, even the chair can come in and weigh in, because that's where the matter lies. Thank you, Chair.
Professor?
Thank you very much, Chair. I will be very quick on this. I have listened quite much, and my colleagues have actually alluded to a number of things that I wanted to discuss. But having said that, I have got two aspects of my questions. Here is to the board, and here is to the management. The chairman of the board, the question I really want to ask is, has Juma ever contacted you, Director Juma? Has he ever contacted you? And has he ever discussed with you of the challenges that he is particularly facing? And if the answer is the affirmative, to the affirmative, what particular actions have you taken? And what have you really done? The next question is about the cumulative term of a CEO in a parastatal an institution is about, it should not be more than 6 years. That's as per the Constitution. A cumulative of 6 years, that's what I'm saying, which means 3 years and 3 years. How about the procurement staff, particularly the procurement director? What did you do about your position in ensuring that procedures are followed? Who should remain at the helm for how long should they be? As per the, the law. I also wonder why you have done, you were also privy, and if you are not, you will tell us, Chairman, why did you commit to such amount of 3.5 or whatever billion that you were mentioning? More than the budgeted amounts for commitments, because the management directly works under you. You are responsible for the funding, budgeting, and planning, procurement planning, for that matter. You have even told us about your budgeting planning initially for the June 2020. Now, Chairman, in my final question, is there any sort of an atom, may it be, of responsibility you should take on the issues raised in KEMSA? And why should you not tell us why you shouldn't take responsibility? The President has cracked the whip. And we're so happy. He has cracked the whip on corruption. 21 days is not far off for it to end, to elapse. My final question is not to you, but to the management now. The suspended CEO, we want to know the funds held between UHC and COVID-19. And I really want to make a serious discussion at a later time in our committee meetings on the issue between the thin line between UHC and the COVID-19. Many of the questions that I would have raised and assertions I would have put were done yesterday. But coming back to Juma, Director Juma, procurement starts and ends at, with you. It does start and end with you. You argued that you were within the law as per Public Procurement Act 2015, Section 2A or B. Fine, that is fine. But was this minuted by your board and KEMSA staff meetings? And do you have documentations to indicate that you have actually done as per within the regulation? Yes. As per within the Constitution? Yes. But has there been discussions and minutes done to the board and, being given the green light to do what you wanted to do? Honorable Jagagwa has mentioned that you have signed all these procurement documents. Why do you wish away responsibilities over it? And my final point of thing is about the acting CEO. How prepared are you for the challenging task to regain the great glory of KEMSA? The public is looking at you. Are you prepared for it? If you're not, you better tell us. Thank you.
Thank you. I'd request that we have the response. A lot of questions go directly to Juma because we had also already to do the submission. There were questions that were raised. And the person also in charge of the PS at the board of KEMSA. So I'll go to Juma first. I will allow the chair, then the CEO. Let me do it again. Juma, CEO, then chair, and then I'll go to Muridi. And do we have your legal person here, Chair? Who is the legal person? Are they, do you have a legal person, acting CEO?
Yes, Fred Wanyonyi, he is not here.
He is not here?
Yes.
Okay. Finance?
Chair, I'm the representative of the PS in the bond.
Okay. Do we have your finance person? Okay. Fine, thank you. So, Juma?
Thank you, Honorable Madam Chair. The first question which was asked by Honorable Kutunyi is that when issuing this advisory or opinion, and it was disregarded, what did I do? My responsibility is that I report to the Chief Executive Officer, who is my supervisor, and I have a responsibility to advise on matters of procurement. That's what the law requires me to do. And therefore, when these procurements were ongoing, when we reached 3.9, we had not broken the law, we had not surpassed the budget, and therefore, this advisory was not mischievous. I was advising, informing the senior management that we had reached 3.9 billion, and therefore, in my own thinking, we should be able to stop because the letters of commitment which had been issued out were adequate to obtain the items which were required. And also I want to bring to the attention of the honorable members that all the commitment letters which were issued to the suppliers were signed by the Chief Executive Officer. None of them was signed by the Director of Procurement. And I remember in one meeting which the chair was there, and the CEO, myself, and the Director of Commercial Services, the chairman alluded to the fact that all commitment letters should only be signed by the Chief Executive Officer. And that's what we adhere to. So there's no commitment letter issued to any supplier for COVID-19 which was signed by the Director of Procurement. And therefore, my actions in making advisory was to inform the senior management of the risk of going above the budget and therefore breaking the law. So it was not mischievous. The other question which was asked was that by Honorable Jagagwa, direct procurement was, it seems, was mysterious. And I want to report that just indicated that when this procurement for COVID-19 began, it was agreed by the senior management that the procurement of this item will be done from suppliers who will have indicated they will be able to supply this item to KEMSA, as the CEO had indicated. And therefore, all the Indian letters were addressed to the Chief Executive Officer, marked to me for just drafting the letters, and the signing was done by the CEO. So not one time did I act on my own violation. So all commitment to the suppliers were authorized by the Chief Executive Officer. And Honorable Chagwaga also brought the issue of a supplier, the name Regal Freighters Limited, knowing that their nature of business was clearing and forwarding. Why did I award this supplier to supply 6,000 packets of face masks? And I want to indicate that the Regal Suppliers was one of the commitment letters which was issued by the CEO. It was not issued by procurement. So this is an authority which was given by the accounting officer, and I could not be able to veto it, because an accounting officer is responsible for all procurements in KEMSA. So he's the one who issued these letters. It was not issued by procurement. The drafting and its preparation was prepared not in procurement. And therefore, I may not be able to respond to why the CEO awarded or gave Regal Freighters to supply this item, because he's the one who authorized them to supply this item. He's one of the suppliers whom the CEO authorized to supply the item. He might have been having some valid reasons. The other question which was asked was that what kind of procurement were we doing when we were undertaking COVID-19 procurement? I want to take the honorable members to the Public Procurement and Asset Disposal Act, Section 103, which is Section E. It deals on direct procurement. And you may note that when you deal with the various methods of procurement, the first method of procurement is open tender, and the second one is two-stage tendering, the third one is design competition, the fourth one is restricted tender, and the fifth one is direct procurement. And therefore, we are dealing with the direct procurement because this is the method we determined, and we agree that this is the only method we can be able to use during procurement for COVID items. And therefore, Section E, or E of direct procurement, Section 103(1), it says, a procuring entity may use direct procurement as allowed under subsection 2, as long as the purpose is not to avoid competition. Section 2 says, a procuring entity may use direct procurement if any of the following are satisfied. It gives conditionalities. Section A says, the goods, works, or services are available only from a particular supplier or contractor, or a particular supplier or contractor has exclusive right in respect of the goods, works, or services, and no reasonable alternative or substitute exist. Section B, it says, due to war, invasion, disorder, natural disaster, or there is an urgent need for the goods, works, or services, and engaging in tendering procedures or any other method of procurement will therefore be impracticable, provided that the circumstances giving rise to the urgency were neither foreseeable by the procuring entity nor the result of the legislative conduct on its part. COVID-19 was not foreseeable. We could not be able to know that we will be able to have this act. And Section C says, owing to a catastrophic event, there is an urgent need for the goods, works, or services, making it impracticable to use other methods of procurement because of the time involved in using those methods. And Section D says, the procuring entity having procured goods, equipment, technology, or services from a supplier or contractor determines that additional supplies shall be procured from that supplier or contractor for reasons of standardization or because of need for compatibility with existing goods, equipment, technology, or services, taking into account the effectiveness of original procurement in meeting the needs of the procuring entity, the limited size of the proposed procurement in relation to the original procurement, the reasonableness of the prices and suitability of alternative of the goods, services in question. The last requirement that for the acquiring of goods, works, or services provided by a public entity provided that the acquisition price is fair and reasonable and compares well with the known prices of goods, works, or services in circumstances. And Section D, we did use it. Section E, where we procure goods from Camry and the Rivertex. And therefore, in this procurement for COVID, we did apply Section 103(2) B and C. And therefore, we did not apply restricted tendering because it will be time involving. It will be invite bidders, wait them to submit bids, evaluate, wait for 14 days, notify, and wait for a minimum of 21 days to sign the contract. So that method will not have been applicable where you are looking for procurement of goods in urgent. And therefore, the method which we used was Section 103 of the law, which gives us that outline. And also the document which I gave, the Public Procurement and Regulatory Authority Advisory and the Solicitor General Advisory advised us how to undertake procurement through direct procurement for COVID items. The other question which was asked is that by Honorable Wino, is that the commitment letters which I've just indicated, which legally authorized or allowed to sign the commitment letters, all the commitment letters for COVID items was signed by the accounting officer, who is the chief executive officer. None of those letters was signed by the director of procurement. The director of procurement only signed what we call it notifications of award. When we did the formalization, I think that's the letter which the honorable member was showing. It is not a commitment letter. It's a notification of award after the delivery of goods. The items have been supplied, and the formalization process has been undertaken, and therefore, I was only notifying of the outcome of a tender, where a commitment letter had earlier been authorized by the chief executive officer. The other question which was wished to respond is on, which was asked by a professor, and whether I did ever one time conducted the chair. When this issue came on board, the chair requested me at one time to give him a brief of what transpired or what took place, and give him copies of the advisory I wrote, and I did a summary, and I sent it to the chair. So I did brought to the attention of the chair the advisory which had already done to the senior management. I think, Madam Chair, maybe those what I can be able to remember, unless there's another question which it has kept me. The other question maybe I can remember is a procurement staff, and with the head of procurement, was the requirements of the law minuted as per the act or the regulations. We want to confirm that every procurement we undertook for direct procurement, for every tender or every supplier, there was a requirement that we do an authority letter which indicated the requirements of the law, which was approved by the CEO. And after that one, we issued an invitation letter to the supplier who had delivered the items to the warehouse based on a commitment letter. And then a negotiation committee was appointed by the CEO, an ad hoc one, to negotiate with the supplier. Then all these documents are available in each respective file. If you look at a file for a specific supplier, you will be able to note and get every respective authority that was granted by the accounting officer. I beg to submit.
Thank you. Unless something that was not answered, we go to the CEO.
So thank you very much. I would wish to restrict myself to the few questions that had been directed to me or touching or on my office or in my office at the time I was there. I wish to state, Madam Chair, that the procurement for COVID items were unprecedented. We have no regulations on how to do emergency procurement, and that's why we relied on the advisory that were quoted and the section that was quoted, section 69 on the retrospective procurement. On the matter of the 9 companies that have been mentioned, as there is no SOPs as to where the commitment letters drafting should be done. During this period, we came up with an innovative method that the commitments letters drafting will be done in the office of the procurement director for safe custody and for reference during the tracking of what we have procured. At one stage, the procurement director was indisposed and was away from office, and I did the commitment letters and referred all the letters to his office for ease of reference. I wish to state that the letter and the advisory that he gave on the 21st of April, we did discuss as management, and we agreed that we will continue procuring and resource mobilization will commence, and we did commence the resource mobilization. As to all the other three memos that have been commented on, I would only restrict myself to the last one. The other two were not in my knowledge, and the final one, I did concur with his advisory, and we did defer the 3.3 billion, the procurement, to this current financial year, and we agreed that subsequent procurements will be open tender, and we said we will not give commitment letters subsequent on the emergency procurement, and we'll adhere to the quality that had been mentioned earlier. Professor Nyikal, Honorable, mentioned about a discussion that we had in Senate. It was misconstrued to mean that I was under pressure. I was not under pressure. The communications that came from the PS office and from the CS were not in any way to put pressure on me. They were operational discussions, and we were on a discussion of how we will continue mitigating the effects of COVID. It was not that I was under instructions from them or under pressure from them to do any procurement. The letters that will be provided by the acting CEO on the procurement, direct procurement, especially for the test kits, you'll be able to see that in those letters, there is no pressure. It's only advising that we buy from Biosensor, Sansure, Abbott, and Roche companies for the test kits. I would also wish to comment that the acting CEO will be able to provide the utilization of the UHC funds and the COVID funds committed by KEMSA. And what I would want to explain to this committee, Madam Chair, is that UHC is under drawing rights, where counties do draw down on the request that they make through our LMIS, and after delivery and proof of delivery, that money is transited from the UHC account to the KEMSA drug account for us to be able to access that money for operational use or for revolving funds to buy more commodities. On the aspect of the cumulative term of the CEO, I will refer the member to the KEMSA Act, which provides that the CEO shall serve a term of 4 years, renewable once, upon satisfactory performance. That act has not been revised.
I'll just correct that.
And I wish to read: the Chief Executive Officer shall serve for a term of 4 years upon satisfactory performance and shall be eligible for reappointment by the Cabinet Secretary for another one further term. On that, on the issue of the other directors in KEMSA, the directors do serve on permanent and pensionable, and they are appointed by the board and recruited by the board. I would also wish to comment that and confirm that it's true commitment letters were signed by the chief officer, that is myself, upon the discussions that we held as senior managements on the commodities that we are procuring, but all notifications, as it has been clarified, were signed by the procurement director. So even by the time we were reaching this, even by the time we were reaching the 5.3 billion procurement, the letters were signed to notify the suppliers of their award. I would also wish to comment that, Madam Chair, on what you had asked me earlier, on the company called Killing. It is true, we gave them a commitment letter on the 9th of April, and this commitment letter was done on the basis when we had, at the height of the crisis in this country, and they demonstrated that they did have a cargo freight full of commodities destined to Kenya. And upon subsequent reviews, we realized that they did not have that capacity. And upon the advice that was discussed earlier, we did cancel that commitment letter, and not a single item was delivered to KEMSA from that company, and no contract was signed, and no payment was given or paid to that company. So it was just a wish that they could supply KEMSA, but their wish was never realized because they were not able to perform. I wish to state that, Madam Chair, that on the matters that are under investigation, we have given our statements, and we wish that we will be cleared of this alleged scandal, because I wish to confirm that there is no scandal. Thank you.
Mr. Muridi?
Madam Chair, I have nothing to add apart from the fact that you requested I submit written submissions. I will do that. I'm guided. Thank you.
The representative of the PS, when all this was happening in advisories, did you take this feedback back to the mother ministry?
Thank you, Madam Chair. I wish to respond by saying that I represent the Principal Secretary, Minister of Health in the KEMSA board, which I believe Madam Chair are able to do, and the chair who is present here can confirm that. And I participate in all the board deliberations, both the full board, special board, and at committee levels. And that, as a representative to the Principal Secretary, I'm supposed actually to report back to the PS. And let me say that, Madam Chair, that before any board meeting in KEMSA, I always share the agenda, invitation agendas of the
Please
KEMSA.
don't take us around, just go straight to the
Yes.
point. The question is, did you report to the PS what was happening, or did you not? So the others are neither
Yes,
here nor there.
Madam Chair, I reported regularly to the PS on what was happening in KEMSA, but the gap, which on this matter, Madam Chair, the gap which is there at the board level on what happened is the gap which is at the board level, Madam Chair, is the gap of information which actually I could not bring as far as what the PS required to know. So that gap, which is there at the PS level, is the same gap which is at the bond level, just as it has been clearly put several times, Madam Chair, in these meetings.
So where is the gap? Just be very clear.
Yeah.
Where is the gap?
The gap of what happened as far as these procurements in KEMSA are concerned and what the board knew. That's the gap.
You want to confirm that the board was not aware, they didn't know what was happening all this time?
Absolutely, Madam Chair. That's a true position.
Okay.
Yeah, that gap is there, and that gap is there, and that's a gap actually I could. That's a gap also the PS and the ministry. There is. Thank you.
But I've seen, as I said, there was communication between the ministry and KEMSA on what was supposed to, they gave authority to incur expenditure.
Madam Chair, I wish to make a comment.
A comment on that?
Yes.
Okay, let me just finish this. So there was communication between the ministry and the KEMSA on the authority to incur expenditure. So as a board member, were you not concerned, on the amounts that were going on? Or totally you were on the dark, you didn't know what was happening?
Madam Chair, the amounts of the procurement from the KEMSA capital, the bond, including myself as a representative in the ministry, we were in the dark, and I was also equally in the dark.
Okay.
Yes.
Suspended CEO, want to make a comment before I take it up?
Madam Chair.
Yes, make your comment.
It would be mischievous to say that kind of a comment. I would want to say that the board, and indeed Mr. Dr. Mbuva, between the month of March and the month of June, they knew what was happening in KEMSA. They visited KEMSA. And at one stage, I believe when they came and found so many cars parked outside, they would not have imagined that the CEO is doing a political rally. We were actually engaging suppliers who had come to do supplies. I do remember that the chairman used to come and make, advisory, and at the end of all this, you'll be visited by all investigating arms. So do everything right. So for someone to say they were not aware, to me, I would wish to say that is not correct. We held board meetings, we did board updates, board reports, and I don't want to comment further. The only issue here we are discussing, and has been confirmed by the chair, is the approved budget 4.6 and the budget that we incurred of excess of 3 billion. But as to what was happening, Dr. Mbuva and Kano Kuria even visited our warehouse to confirm that we have those commodities in our warehouse. Madam Chair.
Thank you.
Chair, let me just, that is related to the question I raised. That it's a clarification. Even if there is a clear instruction from the ministry on a major issue, were there board papers, board reports prepared and put before the board to discuss and say the ministry has said we have 700 something million and we are going to do this because this is a COVID emergency and seek the concurrence of the board? Because if there's an emergency, the emergency is not just for the ministry, it is for the board as well. And I would expect that when the CEO has a major decision like that to make, that decision is taken before the board, even emergency board meetings are called, and that is then discussed, and the board is aware. What is coming here is like the board doesn't know. There's more communication between the CEO and the ministry, and a not clear one between the CEO or the executive and the board. Can the chair comment on this, please? The chair
I take your comment that the chair have not answered the question, so that will be additional. Maybe you'll also take this committee on the structures, the structure of management and the board, you can take us through. Honorable Emanuel.
Mine is an observation, Chair. What we are witnessing, the discrepancies, the blame game between the management and even within the management, the different departments and the board and the MOH is a clear indication of a serious problem that we are yet to identify.
Madam Chair.
Yes,
Madam Chair,
Vice Chair, and then
yes,
then we allow
Madam
the
Chair,
Chair to respond.
Yesterday I did raise this issue directly to the PS about his or her representative to the board. And when I was raising the issue, I did not know you. Neither have any vendetta, because I even can't pronounce your name, because I'm not used to. But listening to you, it confirms the fears of every member of this committee that actually we need restructuring of KEMSA. Owino has alluded to the same issue, Honorable. From the first day, we started investigating this matter. And listening to you, it appears to me that you have no idea why you are sitting in that board. As a representative, you don't represent the PS. You represent the ministry. By extension, you represent the president in that board. And this is what we are seeing every day. That you make the government look so bad. When the president is working so hard to mitigate on this, going an extra mile, then you as his representative, you are letting him down. Waswahili wanasema mkala muue, haki yake mpatie. The CEO has just confirmed that you've had meetings on a number of issues. And here you are lying openly that there was communication breakdown. And you're a government representative in that board. I think part of the recommendation will be the representative of the minister of the PS, the so-called, in that board is inefficient and is disconnected from what is happening between KEMSA and the ministry. That is what is coming out clearly. The reason why we have this corruption now, the reason why we have all this issue, the so-called COVID gate, the reason why we've got all this name calling, it is because of people like you, whom when appointed, they don't go and do what it is expected of them. So will I put it in to you that you did not play the role that you are expected to play, and you are not fit for that, to sit in that board? Will I be right if I put it to you that way? Thank you, Madam Chair.
Owino and honorable members, I would like we finalize on this matter. We have other witnesses waiting. And so, Owino, make it brief.
Yes, thank you, Chair. And just following what Honorable Kutunya have said, I just want to put this directly also to the Chair. Is your board functional? And what is the quorum of that board? Because we have been going through around that board, we don't know how efficient is this board functioning. So I think we need candid answer. Now, to the CEO, the first impression I got was that you signed the commitment letters because the director was unwell. And that brings another question. If the director is deposed, who else is legally allowed to transact on his business? Is it the CEO or there's a deputy director? You know, all this should come to us well. So if there is lacuna in the policy or regulations that you're dealing with, then we can help to restructure all this or bring some more information. Thank you, Chair.
Honorable Chair.
Thank you.
Honorable Chair.
That's Juma.
Yes, I want to just respond on an issue. The CEO indicated that when the commitment letters for the 9 bidders were written, I was indispossessed. I want to confirm to this committee, I was not indispossessed. I was in the office. Only one day was I away in the office, on 5th of June, when the letter for shop and buy was written. All the other letters, I was in the office. So that allegation that I was dispossessed, I have not been dispossessed. And on that day of 5th, I requested for permission for 1 day off only. During the COVID items, I have been in the office 24/7.
Well noted. Chair?
Chair, can I?
Who
Chair,
is it?
Chair, can I? Sorry.
Let's hear Chair first go. Chair?
May I request that I come last so that I can, if you allow me, I can make closing remarks?
Yes, yes. Okay, then representative of PS?
Yeah,
And
Chair.
then I go to the CEO, the
Yeah.
CEO, and then we finalize with the chair.
Yeah, Chair, thank you very much. Let me say that as a representative of the PS, my contribution to the way things are supposed to be done in KEMSA at the bond level would only come through the bond deliberations, Madam Chair, through the various agenda items which are brought at the bond level. And therefore, if a matter has not been brought through that procedure, Madam Chair, and I have failed as a representative of the PS to give the necessary direction or guidance on that matter, I would say I would agree that I have failed. But let me say that in this matter, which is which is under discussion, it is very clear that at the bond level, from the meeting which was held on 19th of May, between that time and the time when now we are talking about these items having been procured and delivered in KEMSA, there was very little in terms of guidance which was brought at the bond level for us to give direction on, Madam Chair, with due respect.
We've heard you. The CEO.
Yeah, Madam Chair, as I said earlier, all commitment letters were done and signed, rather were signed in my office. When I said Mr. Juma was indisposed, I said in some instances when I did sign, drafted the commitment letter, at some instances he was indisposed. On the issue of the aspect that has been brought forward, that we don't have a clear communication between the board and the Minister of Health. All letters are signed and dispatched to the PS, and they are received. All board meetings are recorded, board attendances are signed, and allowances are paid on time. So I would wish to say that what we used to give were board updates on the procurements done through Supply Chain Committee and through the Finance and Strategy Committee, would even give the updates on how far we have utilized the funds. So those minutes are there, and the legal director, who is the custodian of those minutes and the attendances, will be able to give those documents, Madam Chair.
Thank you very much. You said we didn't have the legal director here and the finance. Yeah, I want to give you, you've been listening when you are finally the one to be. Could you give your comments?
Yes, Madam Chair, just for record purposes, there was a submission by the CEO, Dr. Manjari, that there has been a growth of income from 2.8 billion to 4.04 billion in the from the financial year 2015-2016 to 2019-2020. I wish to confirm the same, Madam Chair, and I will give a detailed report in writing to confirm the same. Also on the issue of the reserves, the documents that will come later through the CEO will have that information. The other thing, Madam Chair, I wish to comment is the issue of UHC funds. Madam Chair, UHC funds are intact. Not even a shilling has been used for the wrong purpose, for any other purpose apart from UHC. I wish to confirm that. Out of the 12.5 billion that we received, 5.4 billion has been used, and 7.1 billion is still intact. And we can provide that information, Madam Chair. The chairman had alluded to this, and I wish to maintain the same position. Madam Chair, lastly, there was a question by Honorable Koros on the issue of whether we receive funds from Treasury Direct. Madam Chair, I wish to confirm we don't receive funds from Treasury Direct. All funds come through our parent ministry, apart from where we play an agency role to the Global Fund, and we are paid fees for giving services to the Global Fund. The principal recipient is domiciled at the National Treasury, and that's the only instance where we receive funds directly from the National Treasury. Thank you, Madam Chair.
So would you be able to tell this committee how much money you are holding into your accounts?
I will provide that information, Madam Chairman.
All right.
Yeah.
Acting CEO, before I go to the chair, last time you appeared here, we talked about 300 million. 300 million that was given to you, that was in the month of May. From the Ministry of Health, you were given authority to incur expenditure and buy the reusable masks for the vulnerable communities. There have been issues here that the Chamber of Commerce was supposed to procure. Where are we at that point? Where are we now? Have you already given out the tender, or have the masks been delivered? You're negotiating. Which point are we at the issue of 300 million masks, the reusable one for vulnerable Kenyans?
Thank you, Madam Chair. For the reusable masks, the process is still ongoing.
It's ongoing. You know,
yes.
This issue of process is ongoing. It happened even last week. So where are we? We just want a very direct answer.
We are negotiating, and tomorrow the Chamber of Commerce is coming for a meeting to conclude this matter. We shall close it at that point.
Now, did you do what was its name, reverse? So because if you are negotiating, that means already the items are at your warehouse, or how are you doing this one?
Now, this is not an emergency procurement. We followed it in the normal way, advert, then the documents come. So this is not reverse process. It is not reverse process.
So you want to, can you confirm to this committee that then a tender was advertised, issued, and the bid was won, and now what are you negotiating?
Chair.
Just want to be clear.
Chair, that is very interesting. We have a pandemic going on, and we appropriated that money that people can be prevented, because masks have been proved to prevent COVID-19 infection by 80%. And now what we are hearing, that this was not an emergency.
No, not only that, Chair, we are buying masks at 700 shillings instead of 250 because we are in an emergency. The same time, we are also saying the masks that we are making ourselves for the people of Kenya are not emergency. What kind of contradiction? And Chair, that is the first money we actually asked you, and some of us were in the ministry and told the minister that if you are going to protect Kenyans, give Kenyans who don't have money masks.
Honorable Chair, can I respond to that? Because I have details.
Yes, Juma.
Honorable Chair, I want to respond to that. When this procurement came on board for 300 million, I and the CEO were in the office. We wrote to the ministry because in the letter there was an indication that we consult the Chamber of Commerce. So we called the president of the Chamber of Commerce. We had a meeting in Kemsa where we agreed that we write to the PS seeking for an okay that will be able to procure the items directly from Chamber of Commerce, who will be able to mobilize the item from the various enterprises across the country. And the PS wrote to us, giving us an okay, and therefore I wrote an authority to the accounting officer, which was approved by the CEO, which is a direct procurement for emergency procurement for those items. And therefore, a bid was prepared, and the Chamber of Commerce was invited. By the time we were living in the office, the process was ongoing. So I can be able to confirm it is not a normal procurement.
So that tells us that it has not moved since you left office, because the acting CEO seemed not to be aware.
Madam Chair, point of clarification. The underlying theme of why we are here is about process. So this is something that we had to look into to make sure that process is followed. So that is the answer. Chamber of Commerce are coming in tomorrow, and we'll be able to conclude the matter from there, because we did not want to end up in a similar situation like we are now. Thank you.
No, Chair, we cannot take that. We cannot take that statement. Now you are contradicting yourself. When you go for direct procurement, that is an emergency stage. We understand you're just joining, but I think Juma has really clarified why we appropriated that money. It came from this chamber. So saying that is a process, we all know processes, but some processes are more of emergency nature that cannot be normal. That's what we are saying, and that's why we are surprised when you are saying it is a normal tender. So you have to own that. If you didn't get it right when they are going out, then you should say so, right?
Madam Chair, to confirm, I'm owning it. There's no contradiction here. We just wanted to ensure that due process is fully followed. So we will conclude this as fast as we can. Thank you.
When I see you, could you give us a time frame? Could you give us a time frame when this issue is going to be concluded? Is it tomorrow you're concluding it, and when are we getting the mask to the public?
Allow me to communicate officially to your office tomorrow.
At what time tomorrow?
Tomorrow morning.
No, when I see you since you took over that seat, you've been trying to be very elusive. Very elusive. You know, you try to be gaugy. And you know, we've been around for long, so we know people who can take the committee round. So be very careful we don't categorize you as a very elusive, as someone who appears in the committee in a very clever way. So be very careful. What we are saying is that we don't want to be communicated tomorrow. You know very well. What are you discussing tomorrow? And if it is an issue of conclusion, you know how many days? 14 days? Is it 10 days? Yeah.
Honorable Member, Madam Chair, we are meeting in chamber tomorrow morning. I'll communicate immediately thereafter.
And I hope in your communication we have timelines on when we expect these masks to go out to vulnerable Kenyans.
It will have dates of delivery dates when we expect the first batch.
Very good. And Chair, you can now make your comments as you conclude. And also, Chair, just tell us about that, the 300 million. If you want to add a voice on that, proceed.
Thank you very much, Madam Chair. The questions that were raised, or issues that were raised with me, are not many, and most of the other issues have been answered too. Honorable Owino asked a question, who is supposed to sign the commitment letters, and I believe that has been answered, that the procurement person, and then they were signed by the CEO after they had gone through the process. Dr. Nyikal asked to whom is the CEO answerable, and the CEO is answerable to the board. Now, I was asked, why did we send Mr. Muriithi on suspension? That was coming from Honorable Jagagwa, who has since left. And the issue was, why did we send him on suspension, and yet he was not in the list involving procurement? Let me put it this way, that, like I've said, there are investigations going on. I've read out to you the letter from EACC. It is actually in the volume 1 folder of file that I gave out when I was here last, I think it was last week. And the investigations are going on. Now, Honorable Jagagwa would say that, that Mr. Eliud Muriithi has nothing to do with procurement. I may think so too, but the investigations are ongoing, and once we get the answers to them, like I said candidly earlier on, what will happen then to Mr. Eliud Muriithi, Mr. Charles Juma, and to Dr. Manjari would depend very much on the results of the investigations that are going on. But I do not think it would be good at this time for me or for anybody else to try to preempt the investigations that are currently going on. Honorable Professor asked me whether Mr. Juma did get to me directly. What happened, they have mentioned to you, the 3 directors who confirmed to you, in fact, all the directors who confirmed to you, that I was sitting with them at the commencement of this COVID thing. And I told them that, listen, you have told me it's going to be emergency procurement. You are going to do procurement as an emergency, but I want to tell you one thing. And I told them, and they'll confirm with you, Mr. Juma has confirmed it. I told them to make sure that the procurements were done correctly. That if you ask them one by one, including the finance director who is not on suspension, they'll tell you I communicated that with them. And I told them from my own experience, because I've been a member of parliament, I've been a senator. I told them that in this kind of situation, at the end of it all, I told them you are going to see EACC here, you are going to see DCI here, and you are going to see so many people here, including the Office of the Auditor General, wanting to know what happened, if anything happened. And what I told them is exactly what is happening now. And I said it in good faith, because a lot of money was going to be involved, a lot of money has been involved. Has any money been lost? That is what the investigation is going on now. But I do recall that CS Senator Mutahikagwa yesterday said, and I have said it before, that from where I'm sitting, no money has been lost, but we procured these things, which were worth so much money, 7.6 billion shillings, and now we have a stock of 6.2 billion shillings in our warehouse, and that stock is there, and that is why I had invited you, and I still hope that you are going to do it. One of these days, come and actually verify that the stock is there. Now, am I going to take responsibility as the chairman of the board? That's a question again. Or before I get there, did Mr. Juma get in touch with me? Yes, he did. He actually did not. I'm the one who got in touch with him, because on 30th of July, I called for a special board meeting to be held on 3rd of August. At this time, KEMSA was under the microscope. It had come so much at the microscope. Every news media was talking about KEMSA. We were seeing memos were exchanged between the CEO and the director of procurements. We do not know where the media got them. We were also reading about them. And that's when I asked Mr. Juma to let me know whether indeed those memos were in existence and whether or not he was able to give me the folder. And that discussion and the discussions I had with the CEO, Dr. Manjari, informed the meeting that we had on 3rd of August, at which we were taken through board paper, I believe, number 12, at which we went through the COVID procurements one by one, how much how much we had now reached, and how they thought they were going to fund it. Madam Chairman, let me say this. We are talking about a procurement period of just about 2 months. An emergency procurement period of about 2.5 months, between 15th of March and end of April. You find that no procurements were done after May, except those which were extensions of the periods that had been given. And that's a very short time, because the board does not sit every day. We have not had a full board meeting since March. And when we meet again, we're supposed to have met in August. We did not meet because of all these meetings we've been having. We are going to confirm the minutes of the previous meetings, including the special board meetings that we had. So it is not possible that the board was going to be there and see every single letter that was written to every single supplier at KEMSA. All we did, and I want to say this at the risk of repeating myself, because I think it is important, Madam Chair, is that we had a procurement plan and we had a budget. Then we had COVID coming in mid-March, 2.5 months to the end of the financial year, and the budget was almost completed. The question that you are going to have to determine, Madam Chair, in the committee, for which I have the greatest respect, is whether or not the management at KEMSA acted prudently to be on the safe side, to have these commodities in place, because nobody had, indeed, nobody even now knows how long COVID is going to be lasting. We have stocks worth 6.2 billion shillings. You've said, and that is correct because you represent the people, that people still do not have masks. If we are allowed to offload the stocks that we have, there will be masks. The only question that will be asked, and this is the question we've been asking throughout, is there going to be any marketing, any trade loss? And yes, there's going to be a trade loss. I would like to request this committee to help us save the situation by offloading what we have so that the needs of the Kenya citizens are met, even as we discuss what trading losses there could be because of the market that has shifted pertaining to these commodities. So, am I willing to take responsibility, Honorable Professor? Yes, I'm willing to take responsibility. I'm willing to take responsibility as a chairman of the board, if it comes to taking responsibility. And I'm not going to pretend that I will take responsibility the moment this thing, it requires me to take responsibility. That I can assure you from where I am sitting.
Chair, very quickly.
Allow him to finish.
If you could allow me to
just
finish,
on that particular
then
point,
you could raise the
Let him
issues.
finish, kindly.
I want to say this, Madam Chair, that I've been a chairman of the board now for just about a year. And when COVID came, in or about March, we had done a lot of work, both of reforms and others at KEMSA. We have UHC, and the board met as ought to have met, and I want to assure you, Madam Chair, that this board is very proactive. And we have a relatively new board now. I am just about 1 year. The other 5 members are all of them new, except Dr. Mbuva, who sits as alternate to the PS, and the National Treasury representative of the PS. So we are a relatively new board, and we are very, very committed towards seeing reforms are done in KEMSA. And we are going through a very serious reformation. We're just finalizing our strategic plan, which we have done in conjunction with our global partners. First of all, the GOK, the government, our own government of Kenya, under which we are, and Global Fund and USAID, who are our partners in these matters. So we are not just sitting and watching. And KEMSA has, in the meantime, been growing. Dr. Manjari has told you, as has Mr. Karanja, the finance director, that we've grown from 2.2 billion to 4-point-something billion. That is growth. Then as we were settling in to deal with the reformation, COVID happened in or about March. And now it has just been about COVID since March. And the months of procurement were only those 2 months, 2.5 months of April and May actually, because there were no procurements in March, at least not much of them. So we have not been sitting back and watching. We have had meetings, and we know what is going on. But we as a board gave the management and told them this: you have to be prepared because of this COVID thing that has come now. And that one, I accept. The board told them to be prepared. Did we approve a bigger budget? No, we did not. No, we did not. There was no supplementary budget. Indeed, when we had board paper number 13, at which we were requested to allow an over-expenditure of 3.6 billion shillings to meet the liabilities because of the COVID-19 over-expenditure, the board declined to give that authority because, 1, we needed to have a proper explanation, and 2, because investigations were already going on, and it did not want to deal with figures that then somebody would say we're interfering with the investigations. So, Madam Chair, this board that I chair is a board that is willing to take responsibility should it be found that we have done anything outside the mandate of ourselves as the board. I came here last time. I took you through all the documents, and we did it candidly. And now I'm asking you, as a committee of health, which insists of this matter, and which will be able to make a decision on the matters that we have put before you. I'm asking you to look into the issues and recommend that we should dispose of the commodities that we are having for 6.2 billion shillings. A trade laws will be made, but in the meantime, those masks, those PPEs, and all those other things will be out there serving the citizens of Kenya who need them. I want you to understand, like I tried to make you to understand last time, that we cannot be able to sell those PPEs, etc., for the amounts of money we bought them for at that time because the market has shifted. And I challenged you, because the Honorable